Sandra all the time is here with a cold heart true. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you.
Sandra all the time is here with a cold heart true. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you.
In the celebrity rundown, but first let's get some news.
Big news. I have some important news for you.
Interesting news.
It's Blake and Darren's Spilling the Tea with Sandy.
Cayman's top news headlines of the day from CMR.
Hey, Sandy, good morning.
Hey, Blake and Aaron, good morning. How are you guys doing?
Doing well. Doing well. What do you got for us this morning?
All right. So the Director of Prison Services, Mr. Daniel Greaves, has confirmed, my apologies, that subsequent to prison officer Darren Watson being formally charged with misconduct in a public office and supplying drugs, a decision was taken to place him on required leave while the matter is being investigated.
What do you think?
They also confirmed what CMR reported exclusively over the weekend, which is that, they've been having some problems at the prison as a result of this. So apparently prisoners are not happy.
That they're not getting
their drugs?
Yes.
Right.
Listen, guys, I don't make up the news. I just report it. So they're not happy that they're not getting free access to drugs anymore, or ready access, I should say. They're probably paying for it in some way or another. But anyway, they had some fights over the weekend in the A and the D wing. And so apparently one of them was injured as a result of this. And police were dispatched late on Sunday to kind of assist with putting the prison in a state of lockdown. So
yeah, I saw that. Okay, well,
this is pretty crazy. So we will certainly keep an eye on that situation to see if that develops any further. And in addition to that, the government has said that they are putting together a fuel committee to look at cost-effective solutions to hopefully reduce the cost of fuel. I thought this is what Offreg did. But anyway, this is politicians trying to
Solar
sit
power.
in front of the camera
Solar
and
power.
take, take some credit for what Offreg is already doing. I'm confused. But anywho, it was a very, very interesting picture that included Chris Saunders, Bernie Bush, and of course, Makiva Bush, who just skipped out of prison or court last week. Right. So in other news, there were several car accidents yesterday.
Yeah.
So, I mean, they're pretty wild. Both cars flipping. We've not heard of any serious injuries. Yes. One happened in the early afternoon by Bodden Town, right by the beach, in fact. And that person told individuals at the scene that she lost control of her rental car because the brakes failed. I don't know. But anyway, they might want to check that out. And then the other one in East End last night had a lot of fire rescue, officials at the location. It happened right in front of Health City. We're hoping that everybody's okay. And that involved a truck and what looked like some sort of SUV van, which also overturned. Lately, these vehicles have been overturning. Am I the only one who's like, huh?
I don't know. You see how people drive out there?
I have this conversation quite frequently where I just can't understand. What is the top speed here? 50 miles per hour?
Supposed to be
for most
yes.
people.
Like, how can you flip a car going 50? Most places is less. It's like 50 is top speed when you get out towards East End.
Yeah.
But like locally, 40 is typically. How do you flip a car at 40 miles an hour?
Every Monday, it's like, wow, there's another car that's just wrecked right there. How did they even get there?
I know.
Speed.
So finally, it looks like the government is considering, they're actually having a press conference about this tomorrow, but they're considering a minimum wage increase. The Minimum Wage Advisory Committee has proposed a new minimum wage of $8.75 an hour to address what they call the exploitation of workers here in the Cayman Islands and provide real relief to the lowest paid workers. So this is going to be interesting because you know who this is going to actually impact the most? Domestic workers.
Mm-hmm.
And most of those people that would probably be making $6 an hour are working for low-income Caymanians. So we'll see how that flushes out. Yeah, I mean, I think it definitely needs to be increased, but they better make sure that they're ready to enforce it.
Yeah.
So anywho, those are your news headlines this beautiful Tuesday morning.
Sounds good. Sandy, we'll see you tomorrow for Wednesday headlines.
Wow.
Okay, sounds fantastic.
Bye.
All right.
All right, folks, give me 1 second. Let me just grab our Instagram viewers, make sure that they are live and direct. I know that they love to tune in over there on IG as well. So we will grab them, and then I'll send out all the links to everybody on WhatsApp. We got hundreds of people waiting on WhatsApp every morning who are like, oh, I'm too lazy to go on social media and look for the link myself, Sandy. Send it directly to me. And I'm like, okay, no problem. We'll do that for you. All right. So let me see here now. Shall we get this? Yes. Good morning to everyone. We'll take roll call a little bit later on, but I see all of our usual suspects here. Ooh, Justin joining us from Washington, D.C. Hey, Justin, how you doing this morning? So good to see you. We love it when our international crew is here tuning in. Now, of course, today's Tuesday, and you guys know what Tuesday means. It means that we're going to have Medical Rundown Tuesday. Now, you guys really love this segment. You guys are not even low key about it anymore. Everywhere I go, I'm always getting such positive feedback. I was at court yesterday, and I had a gentleman reach out. Somebody's still asking about flow outage. Let me check on this for you. I had a gentleman who said to me, he works security, and he said, oh, Miss Sandy, I really enjoy and I really love the Medical Rundown Tuesdays because I learned so much. And I was kind of taken aback, but I shouldn't be, because we get those kind of positive comments about this segment all the time. People really love having good medical information and learning something and advice. And today, I think it's going to be a fantastic show because this is something that impacts a lot of people. And, we didn't really have too many options here. We had no options, I think. when it came to, your kidney transplants and that sort of thing. So we're going to bring in Shamari Scott. Good morning, Shamari. Well,
good morning, Sandy. How are you doing this morning?
We are doing good. Looks like you're switching up on us this morning.
Yeah, got to switch it up a little bit. I have to be closer to the door, so I'm going to be leaving a little bit early. Have to get out by 5 minutes to 8, but I know Dr. Amit is in good hands because I have a meeting I couldn't miss that popped up. But all good. No good internet this morning.
Got your shoes on, got your pants
got my shoes on. I got my jacket right here, ready to run through the door.
Wonderful.
But Sandy, as you were mentioning, it's always exciting, especially in this new year, and we're coming up on our 10th anniversary in April 2nd, and then shortly thereafter we'll have our new hospital that will be right there on the Cayman Bay campus. And it's very exciting that we keep progressing. And as we always talk about filling gaps, that as of right now, we have a nephrologist, and his name is Dr. Amit. He has close to 2 decades of experience, but closer to over a decade of experience in transplants in regards to the kidney. And because March is Kidney Month, we have Dr. Amit here with us. And in short order, there's still a few components that have to occur with the government and the such, and a select committee that will look into certain rules around transplants and the such. But the first component of the transplant program that will occur will be with Dr. Meat and his team at Health City, and will be a kidney transplant. And I look forward to Dr. Meat and you having conversation to go over, why the kidneys are vital, what happens when kidneys start to fail, and the fact that now we have a kidney transplant program that will, in short order, be up and running in the Cayman Islands. So Dr. Amit is an interventional nephrologist. Sometimes people think neurologist in regards to the brain, but it's nephrologist for nephrology in regards to the kidneys. And we're very, very pleased to have Dr. Amit with us, who has done over 300 kidney transplants and follows them closely even after the transplants occur as well. Morning, Dr. Amit.
Yeah, thank you, morning. So welcome to the program, Dr. Amit, nephrologist. Wow. Okay. So tell us a little bit. I mean, Shamari has already provided an introduction to who you are and the level of expertise that you're bringing to the field of nephrology and kidney transplant medicine. Over 18 years of experience, which I think is absolutely amazing. Shamari, you guys just keep expanding your level of expertise and the specialists and consultants that you bring on board. Wow.
Definitely, because as we say, Sandy, we look to see over time what gaps exist and where we can make the maximum impact. And as you will hear from Dr. Amita as we go through this interview, that this is a life-altering type of scenario that will definitely help a lot of people who have certain ailments within the Cayman Islands, but even outside of the Cayman Islands as well.
Well, let's go ahead and get into the meat and potatoes of it all. So Dr. Amit, we've heard about your wealth of experience. So let's talk about what your key areas of focus are when it comes to the kidneys, which can you tell us what the function of the kidneys actually is?
Thank you, Sandra. Thank you for hosting me. So today we'll talk about these kidneys. The kidneys are, we have 2 kidneys, and these are on the back of nearby the spine, just below the rib cage. So both the kidneys function in a way to clear the toxin from the body. It's like a drainage system of our body, but including that, they take out the water. And this is not the only function, that making urine is not the only function of the kidneys. They have other functions like balancing your electrolytes in the body, like sodium, potassium, calcium, etc. They also produce some hormones. Those hormones do manage your blood pressure in the body. They do produce hemoglobin in your body. That's how when the kidney fails, you start having high blood pressure, you start having low hemoglobin. That's how it manifests.
Mm, wow. And are there a lot of people you're finding, especially here in the Cayman Islands, who are having kidney related issues? I know there are a lot of people who are diabetic here, and I
Yes.
think the two are very, very closely connected. Is that right?
Yes. So most important thing is identifying the kidney disease, because kidney, as of any other organ, don't produce any symptoms unless it is failed to a very advanced stage where you have lot of fluid retention in your body, and you can see that there is swelling in the feet, you have high
Mhm.
blood pressure, you are pale because you have low hemoglobin. Those symptoms comes only very late stage of the kidney, where as a nephrologist you don't have much to help the patients. So identifying at the very first, because if you go by statistics,
Mhm.
10% of the population have kidney disease. So it is mind blowing that 1 out of 10 persons would have some element of kidney disease. It could be as trivial as a blood in the urine or a protein in the urine, to as big as a cancer in the kidney or a failing kidney. So identifying at the very first helps us to prevent the progression of the kidney disease, help the patients to live with even a failed kidney for a longer time before
Mhm.
the eventuality that comes, that where you need to have a kidney transplant, but you can have a very good life even with a failing kidney for a long time.
Wow. Okay. Now, how big are your kidneys? I mean, I'm thinking, they're large, but maybe they're not that large. Can we get an idea of what
So
size they are?
it depends on the height of the patient. So like
Okay.
a big 6 feet height persons could have kidney as big as 12 centimeter. A small height like 5 feet person could have a as small as 9 centimeter. So between 9 to 12 centimeter you can have the kidney size.
Mm-hmm.
And you have two kidneys, and the good thing is that, so at single point of time even only 40 to 50% of kidney functions. That means the rest of the kidney sleeps, and that's a good backup for our, even the kidney have some insult, some injuries, like due to any other cause, due to infection, due to stone, any other cause, there is some backup in the kidney, and God has given us two kidneys for, so that we can live longer life. So even at this size they do a lot of functions.
Mm. Fantastic. Wow. All right. So for folks, don't forget that the phone lines are always open. If you have a question for Dr. Amit, it's 936-2626. And of course, I know some of you are shy about calling in. So you can also WhatsApp message us any of your comments or questions this morning. And of course, to all of the people who are on the live stream, you can feel free to ask some questions. So tell us then a little bit about this chronic kidney disease. This is one of the obviously ailments that people suffer when it comes to kidney health. So, what exactly is CKD?
Yeah. So, like a liver, when it gets injured, it has a good function of recovery, but the kidney has very limited function to recover. So, patient could have a kidney injury, which could be acute. When we say acute, means the kidney is going to recover over due course of time. But
Mhm.
chronic, when the injury doesn't recover a full course, then we say it is chronic kidney disease. And chronic kidney disease, as such, is not a deadly disease, but it causes a lot of changes in your body. If your toxin is gone, not getting removed, so other organs of the body gets affected. Your heart will get affected because of high blood pressure, your bones will get affected because of the electrical imbalance, your nerves, everything one by one gets affected when your kidney doesn't function. So chronic kidney disease, where your kidney is not functioning well to filter all the waste, the toxins in the body properly. And apart from that, they have other functions where low hemoglobin, your body starts retaining fluid, that's how your blood pressure starts up. So
Mhm.
these things comes up gradually over time.
Hmm. Wow. And what are some of the symptoms then that you might be suffering from this chronic disease?
So chronic kidney disease, as I say, initial stage, you can have some swelling in the feet because of fluid
Mhm.
retention. You may feel fatigue, you may feel malaise the whole day because you have low hemoglobin. You don't feel great. So these are the very initial symptoms. You may miss some of the symptoms. You may not notice,
Mhm.
especially those patients who have some other diseases like diabetes, a blood pressure, a heart disease. So those patients, when they are along with the GP, they are the ones who gets noticed earlier. Patients who don't have all these diseases, still could have chronic kidney disease, and you may get unnoticed for years to come.
Wow. When you do your, we're always encouraging people here in the program to do their annual executive health check and screenings. Shamari, are you aware? Perhaps Dr. Amit will know what's involved in that as well. Is there anything there? I mean, obviously they're testing your sugar levels, they're looking at your heart. Are there some of those things that could potentially pick up on if you do have a CKD to kind of get a head start? Because with all diseases, proper diagnosis as early as possible can help you live a much better life. So are those things kind of picked up during some of the annual executive health checks?
Yes, annual health checkup helps, and you need only 3 tests to diagnose if you have a kidney problem. So first is a kidney function test, where you look into urea, creatinine, all these comes in the blood. Second is just a simple urine test, where it shows is there any albumin or any RBCs, that is the blood in the urine. Third is just an ultrasound to look into the kidney size, if there is stone in the kidney. So these 3 tests comes in most of the health checkups. I think if you are following up, doing annual health checkup, it's good that we can recognize the disease very early stages.
And Sandy, you are correct, and that's why we always recommend the executive health check, so you can have an overall view of what's going on, and there'll be some indicators most times if there is an issue, and then if the additional tests or different additional types of diagnostics need to occur, then we would do it or suggest it at that point in time as well.
Very good. We do have a question. I'm actually going to throw this one up on the screen for us this morning. So this question says, good morning. Can you ask the doctor whether the kidneys are impacted from the long-term use of medications such as Zopicon or Lorazepam?
Yeah, I could understand.
Yeah.
This is lorazepam. So lorazepam is something we take to get sleep. So yes, over long term, any medications could have some amount of effect on the kidney, not necessarily those we don't notice in like painkillers and like some aspirin, those things which are known to cause. Many of the drugs could have some effect on the kidney, but yes, lorazepam is pretty safe. Should I say that even I don't that those 0.1% chance I don't not recognizing. Yes, if you are on some drugs for a long time, do talk to your GP if they have some effect on the kidney. The name he suggested, lorazepam, I think it's pretty safe from my point of view.
Yeah, because you basically said that the kidneys is like a filtration system for the body. So anything that you take in, including medications and everything, pretty much that goes through your body has
to the kidney. Yes.
Out, right?
So, yes.
Yes. All right. We do have a caller on the line. Good morning, caller. Welcome to the program.
Good morning.
Morning.
Is there a list of things to do or to avoid, whether it's actions or substances, that would cause you to have an optimally functioning liver, so that you can avoid unnecessary damage? What should we do in order to have not liver,
kidney.
Yeah, absolutely. So it's all about how you maintain a good healthy lifestyle. So it comes to maintaining a good weight. So you have to eat well, do regular exercise. Regarding water, you need to drink a lot of water. I'm not saying go beyond some normal levels, but yes, you have to drink frequently, especially in tropical countries where you have a lot of sweating, you lose water during your activities. You need to keep on drinking water. You have to keep your salt intake on the lower side so that you don't develop blood pressure. Avoid trans fats, specifically junk foods, where they lead to your high cholesterols and subsequently heart disease, which has indirect effect on the kidney. And all I say is how you maintain a good healthy lifestyle. Second is, when you go to over-the-counter drugs, that don't take on these painkillers so frequently. Do talk to your GP if you are needing some painkillers, if there is any alternate to that. And third important thing, if you have pointers towards that shows that you have at risk of developing chronic kidney disease, like you have baseline diabetes or blood pressure, heart disease, any other vascular disease you have, or in your family, if somebody has chronic kidney disease in the past or stone disease in the past. So do check up, because kidneys, they don't produce symptoms so easily. Only 5% of persons might come to a GP just because they notice some problem in the kidney. So that's why you need to be proactive. When you have some base disease, go to your GPs, ask for a health checkup, where you can pick up these small pointers.
Okay, caller, thank you so much.
But one more question, sorry. He made mention of sodium. And I know that, like, when people are exercising, especially in our hot environment, they like to go to a certain colorful drink for electrolytes. Could you tell us how we should best source those electrolytes? Because I noticed you talking about sodium.
Yeah. So we have to take that whatever drinks you are taking, like a lot of these drinks, or I say fruit punch, we have more of carbs. So I'll say just to do exercise, people used to take a lot of carbs or a lot of proteins to make up those calories that you utilize during the exercise. So carbs to a certain extent is okay, but you have to see those carbs will eventually lead to you won't get your benefit of weight loss during exercise if you're taking fruit punches and all. Yes, you have to see the quantity of the salt in the drinks you have, because if they are having salt, you should avoid those. So salt intake should be limited to only those amount you are doing to cook or make some food for you. It should not be additional or supplemental any fluid or any drinks you're taking. They should not be consisting a large
Do they
amount of
actually
salt.
put, Dr. Ami, their drinks that include salt in them, like have sodium?
Not necessarily every drinks. Most of the drinks will have sugar. You have to go and see if sodium. The sodium is sodium chloride is salt. So yes, you have to just see. Usually, all these drinks don't have a lot of salt. I don't know if specifically he asked for any drink, but yes, they have a lot of carbs. So necessarily, and we usually avoid fruit punch and all with very high carbohydrate drinks, because eventually they produce a lot of oxalates in the blood, and that leads to kidney stone. So we avoid normal water is the best thing we can have.
And when it comes to, I thank you, Denny. Is that your final question?
Yeah.
Okay, thank you so much. All right. So when we talk about, I heard you just mention kidney stones, and this is something that is in. What exactly are kidney stones? Is that indicative of any sort of chronic kidney health issues that you need to be looking out for, or do most people at some point in time have the random kidney stone?
Yeah. So to sensitize people about kidney disease, we do include kidneys with stones as chronic kidney disease, but not necessarily these kidney disease are progressive unless we're not treating the stones, and the stones are obstructing the kidney. They're not letting the kidney to do the normal function. So only those cases we need to be concerned. But otherwise, a small single stone, at almost 3% of population can have anytime in their lifetime one stone in the kidney. That don't necessarily means that they will damage the kidney, but yes, there are a lot of precursors which leads to kidney stone formation. And a normal person who drinks a lot of water, keeps the salt intake to the lower side, and eats a lot of fruits and vegetables. But fruits and vegetables have they alkalinize your blood. So when you have alkalinization of blood, so the stone formations comes down. Sodium in the salt leads to stone formation. They bind to calcium. If you drink a lot of fruit punch and all, they have high carbohydrate, like I said, high oxalate, they lead to stone formation. And above all of these, if I am drinking regularly a good amount of water, my kidneys does the flushing action. So whatever stone trying to form from the small size, they get flushed out if I'm drinking a lot of water. So water, number one. Number two, salt. And third is low carb diets. So you have to, whenever you don't take a lot of carbs at one time.
Wow. Okay. Very interesting. We do have a question from Negra says, good morning, all. Question. So if you have high blood pressure, does it mean that your kidney starts to fail? So what's the connection? We have risk factors here for chronic kidney disease, and diabetes and high blood pressure is at the top of the list. So what is the connection between high blood pressure and kidney issues?
Very good question. Like I said, that blood pressure, when you have high blood pressure, should check for kidney disease. It's not that blood pressure always leads to a kidney disease. So there are some blood pressure whose runs in family. So we call them familial blood pressure. So if my father has blood pressure, I could have a blood pressure. Usually these things comes, these are genetic, and they usually comes around the age of 20s and 30s. When you are 34, 35, so that time you usually what age your father or mother has blood pressure, you will get that. So these are the usual times when you get blood pressure. But there are unusual times. So your age is 18 or 15 and now you have a blood pressure. Your age is 40 now, you didn't have blood pressure till now, and you have a new blood pressure right now, you recognize. That means it's not due to familial or it's not due to genetic. So you must check your kidneys, because 95% times when the age of your where you get the first diagnosis of blood pressure is beyond this range, you will have some amount of kidney disease. So most of the times kidney is the precursor of blood pressure. It's not heart. That people thinks that if I have blood pressure I need to go to meet a cardiologist. It's not like that, because heart problem is the after effect of high blood pressure, but the blood pressure precursor starts from the kidney. So it's a nice proverb in our medicine: if you don't have the two kidneys, you will never have a blood pressure. So if I remove two kidneys from the mice, he will never have a blood pressure in his lifetime, but he will die eventually of not having a kidney. But yes, the kidneys are the main precursor of blood pressure. If you have high blood pressure, so usually those blood pressure who comes genetically, they're like 140s, 150s, they usually stay in like that, and within one drug they get managed. But if your blood pressure is high, going towards 160, 170, 180, and you are requiring more than one blood pressure drugs, 2 3 drugs, that means you must check for your kidneys. You ask your GP that you must check kidneys, and if you have any signs and symptoms of kidney, you must be referred to a nephrologist so that they can act very early on the stage.
Very good. Some good questions here. We have Damien says, good morning to all. If you do a detox of your kidneys, what are the signs that it's doing well, and how long before you start to see the results? So this is one of the common things that people think they can detox their kidneys. Is that something that you can actually do?
This is very looks very good fancy words, but I don't know how you are going to detox your kidneys, because kidney doesn't act in that way that you can do something to force the kidney, which are the only thing that the kidney can do. So kidney can tolerate as low as 500 ml of water intake in a day to as high as 14 liter of water intake a day. So kidney can function as you like that. Like I said, kidneys, 50% of kidneys sleeps at one point of time. If you want to overwork them, they will get up, they'll work, and then go back to sleep. So I can't do anything about the kidney, but whatever happens in my body, the kidney functions to that. If I'm drinking a lot of water, kidney will make a lot of urine. If I'm drinking 1 liter of water, they will just make 700, 800 of urine. That's how it works. So no way I can detox. Yes, water intake is one thing that I'm keeping my kidney functions. They keep on removing the toxins. They need some water so that they can remove those toxins. So water intake is one part that kidney wants, that you should at least take more than 1 liter of water in a day.
So basically, Damien, that's a bit of misinformation that we've probably all heard, that you can detox this and detox that. And he's essentially saying there's no such thing as detoxing the kidney. But we see the risk factors here: diabetes, high blood pressure, heart disease, obesity, family history of chronic kidney disease, inherited kidney disorders, older age. And if you've had past damage to your kidneys, some of these things are controllable. So diabetes and high blood pressure, heart disease, obesity, those are things that you can actually do something about. The other ones, maybe not so much so. But if you keep those things under control and you keep within what would be considered optimal health, then obviously you're helping not just your kidney, but your heart and all of your major organs to function optimally. So yeah, that's how we gotta remember about those lifestyles, things that we do every single day. Speaking of lifestyle, prevention and
Sandy?
treatment. Yes, sir.
Sandy, I'm having to run, but
Yes,
I know
thank
Dr.
you.
Amit is in good hands with you.
Yes. Before you
And just
go, can you tell us about the upcoming Catwalk for Cancer event?
yes, the upcoming Catwalk for Cancer event is happening this Thursday at Cayman Bay. I actually closed down my information for exactly when it starts. But tickets can be purchased from the Cayman Islands Cancer Society. So all proceeds go to the Cayman Islands Cancer Society. And as you know, Sandy, it's a fashion show, and we always pick certain charities to be able to give back to, an understanding that obviously even prior to us having our oncology unit, we used to support cancer, but even more so now that if you ever need it, we have our radiotherapy center there as well. And the Cayman Islands Cancer Society has done so much over the many years in order to help people in need that have certain issues, monetarily and otherwise, from a oncology perspective, that we always look forward to supporting them. So it's this Thursday. All proceeds go to CICS, which is the Cancer Society, and tickets are $75, and it starts at 6:30 at the Paseo at Cayman Bay, the Catwalk for Cancer.
Okay, beautiful. So come on out, folks. Support this amazing event. It's going to be on this Thursday at 6:30 p.m. at the Paseo there in Cayman Bay. Again, Health City supports a lot of NPOs when it comes to all sorts of, cancer organizations and heart organizations. And, they're there to offer them as much support as possible. So now they need your support. All the proceeds will be going to the Cayman Islands Cancer Society. So make sure you get your tickets early. There's limited availability. I need to get a ticket myself.
Look forward to seeing you there.
Awesome. Thank you so much, Shamari. Have a good day. All right. So, Dr. Amit, it's just me and you. We shall continue our discussion this morning. So we talk about prevention and treatment. Now, I have someone here who was saying that a naturopath once gave them a remedy. Oh, we got a phone call. Good morning, caller. Welcome to the program.
Yeah, good morning.
Good morning. How are you?
Okay, and you?
Good, thanks.
Okay. I was calling to ask the doctor,
yes,
how important is it to be drinking coconut water when it comes to your kidneys?
Okay, this is a good question. Thank you so much. So, Caribbean people, Doc, we believe in our good old fashioned coconut water. So, is this something that is useful to the kidneys, and is it better than regular water?
But coconut water contains a lot of potassium, so you have the potassium helps in controlling your blood pressure. So yes, coconut water, one, because it is water and you are getting some fluid into your body. It contains the electrolytes potassium that helps in your controlling blood pressure. I'll suggest for a normal person to drink a lot of coconut water, not a problem. But if somebody is having a failing kidney and there are some kind of blood pressure drugs that do interfere your potassium in the body, your physician or nephrologist will definitely warn you about taking coconut water. For them only, it is prohibited, but for a normal person, a good working person, they should take coconut water. It's a good thing.
Please tell me that amlodipine is not one of those blood pressure drugs that has anything to do with interfering with coconut water.
No, amlodipine is not that.
We're good. All right, good stuff. Because I love me some coconut water. Now, I mean, everything in moderation, right? So is there such a thing as too much of a good thing? Too much coconut water can not be good for you, just like too much water?
No, not like that. Coconut water is good. If somebody is loving it and taking, I have no problem, because they don't have a lot of salts like other fruits. People take lemonade and all, they have salts in them. I prevent them, just drink as limit as you can. But yes, coconut is a very good drink to have.
All right. So I'll continue drinking it. Now, tell me something along the same question with coconut water. Why is it that whenever I drink regular water versus coconut water, I find that I have to go to the bathroom so much quicker and so much more frequently with coconut water?
Yes, because it contains what I say, solutes. Solutes means your sodium, potassium, calcium, some amount of carbs, they are solutes. So whenever you are drinking, like you drink a beer, so it contains the wheat, the barley, whatever they have, they are the solutes, and they drag water with them. When the kidney filters, if they are loaded with solutes, they will have some water to take out those solutes from your body. That's why you pee more when you have drinks which have something extra than only pure water. Water goes to your body, it gets utilized, and kidney makes whenever they want to remove body. But when you have drinks which have carbohydrates or any other electrolytes, you might feel peeing a lot earlier. Yes.
Very interesting. Very, very good. All right. So we do have another question here from a listener to the program, and this one is quite interesting. Let me just grab it here one quick second. So this is about, they had a naturopath once give them a remedy of a liter of grapefruit juice mixed with olive oil to pass kidney stones. This sounds kind of interesting. And suffice it to say, all that happened was I threw up very badly. My question is, are such recommendation old wives' tales? And are there any alternative ways besides water to flush kidney stones?
Yeah.
This is flush the kidneys, but I think
yes. For the kidney stones, I can see that the first time I heard about giving grapefruit juice to flush out kidney stones. So to be just for a caution that what I said about kidney stones, most of the times we talk about calcium oxalate stones. So calcium oxalate stones, for like in a community when you have stones without having any disease, 75% of time you have calcium oxalate stones. The only thing that works with calcium oxalate stones is drink a lot of water, low salt, and alkalinize your urine. So whatever you drink you take to make your urine alkaline, they will help in reducing the size of the stone. Then they will not necessarily flush the kidney stone out. The flushing part of the kidney stone depends upon the urine you are making and the size of the stone. If the stone is less than 10 millimeter, that is less than 1 centimeter, they may pass through your ureter and comes to the bladder. But yes, anything beyond 10 millimeter may not pass through. It may stuck in the kidney, and that has to be remedied in other ways. And alkaline urine, one thing you can always do is having a lot of fruits, and yes, juices do help. So these remedies is like something I am expecting somebody beyond the science. So yes, they help in reducing size because they're helping in alkalination of the urine. The other part, the other 25%, if I go, there are some stones that form due to a defect in the kidney, or there is some infection in the kidney, where these things backfire. So they need acidification of the urine. That means you have to give something to make the urine acid. That's how the stone size will come down. If you give alkalination, they may form bigger stones. So first confirm which kind of stone you're having, and then you go for therapy specifically for alkalination. If your stones are very big, these things may not work, and you might have to remove the stones other ways. There are different ways to remove the stones.
Okay, interesting. All right. So Gabby has a question. Gabby says, how soon will they be doing transplants on island, and do they have a waiting list as yet? So this is quite a good question, because obviously I think you guys are still waiting, Shamari said, on legislators. Yes. There's still things that they have to do.
Yeah. So I was, before I come to island, I was doing transplant right till the January. Had around 300 transplantations to follow up. Wow. So my protocol systems, the surgeons, everything are ready, and we have around 3 patients from the health city itself, and there are a few patients from HSA who are willing to go ahead for the transplant. The moment we get the final approval from the transplant council, we'll go for the donor evaluation. It should not take more than a month, and by I think till the 10th anniversary of this hospital, we might be able to see the first transplant that's been done in this island.
Very good. Okay. So thank you again, Gabby, for that question. Good morning to Sophia. Lisa says, does lemon water help reduce kidney stones?
Yes, absolutely. For the calcium oxalate stone that we're talking about, is the most common stone in general population. So lemon water, they do have vitamin C. So vitamin C produces a lot of oxalates, and they can form stones. But what lemon has extra is citrate. So citrate is one thing that alkalinization in urine. So lemon water do help in reducing the stones. If somebody has a stone or they have passed stone in the past, I usually say drink at least 15 ml of lemon juice every day. So you can mix with water, you can take in empty stomach, don't add salt to it, but you can drink it. So lemon water do help, but this has to be a calcium oxalate stone that only your GP or a nephrologist can tell you which kind of stone you have.
Very good. All right. So thank you, Lisa, for that question. Dean says 1 clove of garlic and a spoon of olive oil before breakfast is good to pass kidney stones. Take it for 14 days. Is that true?
I don't think so.
Okay.
So stones can pass on its own. So it could be incidental that you're taking something and the stone is passed and you believe that, okay, this might be the reason.
Yes. And do most kidney stones, what percentage of stones actually just pass on their own?
Yes, small stones like 4 mm, 5 mm stones, they may not cause pain. You just have slight bit of pain while last in the end towards passing. Anything around 6 to 8 mm stones might have some pain, some blood in the urine, they pass out. Beyond 8 mm stone, they may pass, they may stuck in the kidney, they will cause pain. And like recently, one of the patient that in the island, he was not getting appointment for a long time for his stones. I gave him some medication. He just passed before yesterday, and he called me. Should I come back and see? Do definitely bring your stone. If one time you can catch hold of your stone while it passed away, bring the stone, get it analyzed, what kind of stone it is. So it helps us to prepare your diet plan so that you don't have recurrence, because almost 10% of patients who have passed stone in the past will do have recurrence in the future. So it's always better that if you have stone disease, you should be on a diet plan so that they don't recur. It's just a small amount of changes, not big. So it just disciplines your life. That's it.
All right, very, very good. So some excellent information here, folks. It's good to know these old wives' tales. Not all of them are true. So maybe just see a doctor. All right, so let's talk a little bit. Gabby brought up this question of kidney transplants. How does a kidney transplant work exactly?
Yes, very nice question, because for a person, when they ask if you take a kidney from a donor, first thing is what happens to the donor, what happens if he is stuck with only one kidney, and where do you put the kidney in the recipient, that the patient who gets the kidney. So first thing, like I said, God has given us 2 kidneys so that we live a longer, better life. And in your lifetime, you can have a lot of things that happen, may or may not happen. Like one time we got COVID, it was so serious that everybody got affected by the COVID. Some people have a very severe COVID where the kidney gets also affected. So when you have 2 kidneys, so kidneys helps in the backup. Like your lights are gone, you have a generator so that it comes back and gives you light. So the kidney always helps us. 2 kidneys always helps us to have a good backup. But when a donor gives a kidney, it not necessarily makes them some patient. It actually, the single kidney in him also works as good as 2 kidneys. The only problem is that they don't have a backup. So I don't expect everybody to have very serious disease in life and their kidney will lose. So it's a chance that we are taking. If somebody gives a kidney, he will still stay healthy for the lifetime. The only thing that matters, that if they have diabetes or if they have some other disease which can affect the kidney, so we make doubly sure that donor, when gives the kidney, has a good lifetime with the same kidney that is left with him or her. The kidney that goes to the recipient, the transplant patient, is placed somewhere in the front. I'll say near your groin. Most of the times we put it on the right, unless the right is bad, and then we put on the left. So, but we don't remove the old kidneys. The old kidneys are towards the back. They stay at that place where it was, but the new kidney comes to the new place. And
really?
Yes, you are now, you have 3 kidneys, and next time the kidney transplant kidney fails, so then we put another kidney that go for the other side. So people have 4 kidneys at one point of time. If you want to go for third transplant, then only we remove 1 kidney and put another kidney on that place. So
how many kidneys can you have?
You can, at a transplant patient who have failing kidneys, having a multiple transplant, they can have up to 4 kidneys.
Wow. I've never heard of such a thing before. Wow, that's amazing. So is there a reason why you don't remove the old kidney that isn't functioning well or functioning at all? Why do you leave it there?
Because they're as dead as stone, so they don't work, they don't do you harm. So
Okay.
removing them is only required when they have been infected or they have some chance of cancer. Only then remove, because removing kidney is a bigger surgery than putting a kidney. And if I remove from a kidney, his health might go down because of the surgery that he has undergone. So we don't mess with the kidneys that is already there. So once they die, they just become stones. So they don't work, they don't do any harm to you.
Okay, there you go. I never knew that. So you just add it to the front, you said?
Yes, add it to the front, and the single kidney that goes to you works as good as two kidneys that you had in the past.
Okay. And how do you attach the kidney? What are you attaching it to when you do a kidney transplant?
So your kidney have two blood vessels. One is vein, one is artery that goes blood in and comes out. You attach to that to your those arteries and veins that goes towards the legs. We attach to those, and you have one ureter that takes out the urine from the kidney, and you attach to the same bladder that you have. But you don't mess with the other kidneys and their blood vessels and their ureter. They are still there. We put a new kidney. Three things has to be attached.
All right. Well, I'm not the only one who found this super interesting. Sharon says, wow, it is pretty interesting. Lavana says, kidney stone pain is worse than labor pain. I wouldn't wish it on no one. Thank God I went to Health City. So how do you know? I mean, I don't think I've ever had a kidney stone. So how do you know when it's like a kidney stone? Like what kind of pain? What does it feel like? Where do you feel it?
So kidney stones, because kidneys are on the back, you have pain on the back side. On one side, we call it loin pain.
Okay.
And they don't have that mild throbbing kind of pain. They will have sharp shooting pain. Most of the patients who have back pain due to some muscular disorder or the spine, they confuse with maybe due to kidney stones. But whenever the kidney stones stuck in the kidney, they produce a very sharp kind of pain, and you might have nausea while the pain is there, because that's one stimulus. Whenever any tubular organs in your body has something stuck, you will have nausea. So
Wow.
pain on the back shooting towards the front or towards your groin and nausea are one that tells you that it could be more of a stone. But it's always good that if you are confused, get a ultrasound done. Most of the times kidney stones gets picked up by ultrasound. If not, then the next step is go for a CT scan.
Okay, well, Power Liking says it feels like death. Oh my gosh. Horrible. And Lisa says, yes, it's horrible. My goodness. So if you're feeling that much pain, I would think the best thing to do is definitely to see a physician. And when patients come in and you diagnose them then with kidney stones, what then is the next step for treatment? Is surgery normally required if it's that painful? I mean, people are saying it feels like death and how horrible it feels. How do you help them with a kidney stone?
So some of the stones in the kidney doesn't come on the way where you pass the urine. So they are best left behind unless they don't do any pain. They do any pain, or they can cause infection. So most of the times we left behind and just keep an observation. Those stones come in the way. They can be broken down by the ultrasonic method. And sometimes the stones are so small that you don't need to ultrasonic method. You can go through a pipe that can pass through from the down under and goes to and take the kidney in a basket, get the stone in the basket and comes out. Sometimes some difficult stones needs a scope to be put into the kidney directly from your skin, so they can take out the stone. So they break the stones, take out in the basket and comes out.
And is it normally the case that when you have to seek medical intervention that it's more than one stone, or is it like one large stone, or what are we
Even people have multiple stones, they may not need any surgery, but they do need medicines so that they don't form more and more stones. Even a single kidney stones can be so serious, so painful that you may need a surgical intervention. But surgery, before surgery, I'll suggest you can do some medications and all to dissolve the stone if it is possible. But sometimes the stone is so stuck that you might need a surgery ASAP.
Yes. So Jackie's asking about signing up to be an organ donor in the States. You can check this on your driver's license. Now, I'm sure this is part of the legislative process, but do you have any idea of how it's going to be working if you want to be a donor?
So this is what they mean is a donation after life. So cadaveric, the like deceased donor transplant has not started yet in the island. Once we start this live donor kidney transplant, we might be able to start registering for deceased donor. But yes, this is one that somebody gives away in an altruistic way that they want to donate, and we can only take the donation from these persons who are brain dead. So sometimes you die of natural death. So once you are you have death, then you cannot give any other organs. Only patients who have brain dead because of a big stroke or because of big accident where there is no chance of brain to come back. So they only come forward if they have registered themselves as organ donor, and if their family members agree, they only come forward to donate their organs. So kidneys, kidney, cornea, lungs, heart, liver, you can donate any organ, but patient has to be brain dead, and if they have placed their organ beforehand, it's easier for the family members to recognize and agree upon that. This has to come from the legislative council rather than us. It is more of a legal thing than a medical thing.
Yes. And it's so interesting because you said basically it is possible if somebody's in very good health that they can live with one kidney.
Yes,
so yeah.
And interesting to know that even 1 to 2% of population may have one kidney. They don't know. And later in the life, they have some pain abdomen. Somebody does ultrasound. They say, wow, you have only one kidney, but I have no problem. So they don't necessarily have kidney disease, even if they have one kidney. So if one kidney, they can live for 80 years, then you can understand you don't need a two kidney, but two kidneys as like a luxury for us. God has given us two kidneys. We are messing around it every time, but yes, we are still healthy. And organ donation, especially kidney donation, is one thing that is very widely acceptable, because we know that one kidney can give your lifetime of good life. So you can donate your kidney if you want.
Interesting. So wow, okay. That's so people can just be born with just one kidney. They never know
and
it.
They should not have they should not have problem. Only 5-10% patients, the cause of single kidney could be some genetic reason. They might have some problem in the life, but just a disorder of only having one kidney doesn't make them a kidney patient.
Very good. All right, we have another caller. Good morning, caller. Welcome to the program.
Yes, morning again. What is life like after having a kidney transplant?
Yes, I could understand. Yes.
What is different about life after? Like, what do you have to do? What are the effects? Like, anything.
And kidney transplant, after kidney transplant, if I'll give one example, I always love to give that example. So whenever my patient comes to me with a kidney disease and very advanced kidney disease, they're not always in a good health, and you can see and tell that this is a patient. This might having some problem whenever they come to my chamber. When somebody has gotten a kidney transplant, I ask them to come into my chamber, ask the patient, recognize if it is it's a relative or a patient. They will never recognize him as a patient. He looks absolutely normal. He's in good health. So after transplant, these are like life-changing experiences. Somebody has gone through a very painful part of dialysis in their lifetime, and they get a transplant kidney. They live absolutely a normal life. So what changes after transplant is something that we should all be living like that. So we discipline them. So you don't touch anything. Don't touch anything means in the public places. You don't mix up with a lot of public people, because somebody might have a viral disease. Somebody coughing, and you might catch up some infections. So what COVID taught us, like you just don't go and mingle around in a very crowded place and all. Be hand hygiene, having hand hygiene, specifically when you're touching something in the toilet, something in the public places, do clean your hand, and live a good healthy life. You do exercise, you manage your weight, you have avoid junk foods, avoid smoking, you moderate your alcohol intake, whatever you're taking. It should not be I'll just give an example, not a single beer more than in a week. So if I am going to live such a life, so this is what everybody should have. Everybody should have a good lifestyle. They should have be exercising, they should be maintaining their weight, they should be avoiding junk foods. So it's normal for everybody. So what different for them? There's nothing. The only thing is that little bit on the hygiene side, there has to be on hand hygiene and avoiding crowded public places. That's the extra thing they have, but that don't prevent them going to the public places. They can still wear a mask, mix with the people, they can go back to their work, they can go back. My transplant patient in the island goes to skiing in Vancouver. So what do you need your life?
What about drugs? Do you have to take any drugs?
So they will be on medications after transplant. Those medications are completely different from the medication they do get at the time of kidney failure. So those medications do have some problems, like they may look a little puffy because of the steroids and all. They may have some weight gain, and there are only 3 medications that continues post transplant. So the discipline is about taking those medication every time, every day, till the rest of your life, till your kidney works. So that's the discipline, like a military discipline that comes to you.
All right, thank you.
Thank you so much, Danny. Appreciate it. Right. So we have Faith. Jackie says, are there other organs that could be donated in Cayman and that doctors need beside kidneys? So, I mean, all organs, I think, are if they're available. People always need different types of lung transplants, heart, and everything else. So I would say, just like everywhere else, the answer is probably yes. But again, waiting on legislation, the medical profession is waiting for those things to catch up.
Yeah. So here in the island, we are wait listing for only kidney transplant for now for the recipients, but there are other patients, those are still in wait list for a lung or liver or a heart. So once we retrieve organ from any donor, so we can retrieve all other organs, that because if one organ cannot be retrieved because of some infections, I think that means no other organs can be retrieved. But yes, once we start the deceased donor transplant program in the island, we can collaborate with other transplant centers like in US or in Caribbeans. So those who are on the waiting list, we can always transport the organs to those places and we can get the transplant done. So only one donor can give 6 to 8 lives.
Yeah. All right. Allison says kidney stones are nothing to play with. I had them and the pain is really bad. I thought I was going to die. My goodness. I'm glad I haven't had this yet. Louise says, is there a difference between bladder and kidney stones?
So usually stones form in the kidney and they pass on to the bladder. Bladder stones are easy to retrieve. So like we put a catheter in your Foley's catheter that we just can go through a cystoscope and take out the stone and come out. While kidney stone retrieving is little tricky, little bit of more surgery is more intriguing. Like you need a urologist or intervention radiologist to go and remove the stone. But this bladder stone can be removed by any general surgeons. They can put a cystoscope and take out.
Very interesting. All right, some good questions here this morning. Ms. Faith says that she had one that was flushed out in 1 year just by drinking more water. Does it normally take that long?
Yes, it might be there in the kidney for a long time and just 1 day passes out. Yes, the water intake is the most important part. Low salt is the second important part. Third is what I say is alkalinizing your urine. So you drink more fruit, drink lemon water, eat more fruits and vegetables. And one that prevents from having more kidney stones is losing your weight. Obesity is one that is linked to kidney stone formation also.
Obesity,
yes.
Oh, Another reason to keep the weight under control. All right, folks, we do have another caller on the line. Good morning, caller. Welcome to the program.
Yes, good morning, and good morning to you, doctor. I have a question.
Good morning.
Is gallstone and kidney stone the same thing, doctor?
No. They are in different organs and they're completely different, and their composition is also completely different. The gallstones are more of cholesterol dependent, and whereas kidney stones more of calcium oxalate dependent. So the interesting thing is you can catch a gallstone on ultrasound, but you cannot see a gallstone in CT scan. You cannot see. It will be like nothing.
So you can't see the gallstone on a CT scan, but you can see it on an ultrasound.
You can see an ultrasound, but can't see it in a CT scan.
Why I'm asking, because in 1999 I had laser surgery, and they said I had gallstones. And they weren't looking for that, but the doctor discovered it, and they said that they were painful too, and I would probably need surgery, because they said that I had a nest. What they took out of me was a bunch. It was a real big one, and then it was a little padded little ones, because I have the thing in my hand now where they gave me in a bottle with alcohol, and over the years it, like, I call them disintegrate. I don't know. It's like a big white mass in the bottle, but when you open it, all you can smell is just alcohol. I have it right in my hand now. Dr. Bromley did my surgery, and but I didn't have any pain or anything. But they told me that they gave terrible pains. But then because they found them, they said, well, I had to have them out, and I had laser surgery, just like 2 or 3 little punches. But I had a whole bunch, and they were ugly. They had looked like sea rocks or something, and I'm wondering, if it was. But they told me it were gallstones, so I was wondering, if it was the same thing.
Yeah, I think your gallbladder must have been removed while removing the stones. If they are not removed, that means those are kidney stones. We might be confusing, because whenever they remove the gallstone, they remove the gallbladder itself, because gallbladder is just like another vestigial organ like appendix. So they don't keep the gallbladder behind. So then they must have take out the gallstones from that bladder and gallbladder.
I think my bladder is out. Yeah, but do you think now? Because this was from 1999, and I'm 69 now. So you think that I should? I mean, I was younger. So you think I should have like in a check or whatever to?
I think you can do an ultrasound of the abdomen, so that we can know that if your kidneys are fine, and we'll also get to know that how the gallbladder is removed. There should not be any gallbladder there. So that's it's just a routine checkup you can do. And along with that, I said kidney function test and urine test, so that we'll know the health of the kidney, and you can meet us anytime.
Yeah, because this was the night of the 1999. That's a long time.
Yes. All right. Thank you so much, caller.
All
we
right,
appreciate
sir.
it.
Thank you very much for the information. But I just wanted to know, because that's what they told me, gallstones.
Yes.
So I, wanted to know the difference of both. So thanks very much, sir, for the information.
Thank you so much. All right. So the gallbladder completely different from your kidney.
Gallbladder from kidney stones. Yes.
Yes. Okay. Oh, we got another call. Wow, you're very popular here. Lots of kidney related questions. Good morning, caller. Welcome to the program.
Hi, good morning. I would like to ask the doctor a question, please, regarding the gallbladder. Do you do the surgery for that also?
I don't do, but yes, in Health City we have gastrosurgeon who does surgery on gallbladder.
Okay, so that's a different specialty completely.
Different specialty, yes.
Okay.
Yes, but they do have it available at Health City. So you can get a consultation there if you have any issues with your gallbladder.
Okay, all right. Thank you.
Okay, thank you too. And just out of curiosity, I mean, maybe we need to do a show on the gallbladder, but what does the gallbladder do exactly? How is it different? Because people seem to be confusing it with the kidney. What's its function?
So to digest our food, our liver makes some bile. So they goes and stays for gallbladder. When you have food now in the stomach, then they pump the bile into the stomach so that they go and digest the food. So it's just a temporary keeping for yourself. So that's why I say it's a vestigial. You can remove it if you find it's defective, because anyways, when you are eating food, your liver will anyways make the bile. It is just the extra bile that you have. It's like you have food, you have made food, but you have extra sauce on your side. You might require some time. You can add on sauce to it. So that's how it works. So not having a gallbladder doesn't cause problem, but yes, gallbladder have these small functions.
Interesting. So Power Light King says Dr. Manoj, as most should remember, is the one who I guess deals with that. Soka says Shanka Piedra Stonebreaker is very good for kidney stones. Have you heard of this Shanka Piedra before?
I have not.
Okay.
I have to check.
Sounds like probably something that's used in
because,
Miami.
because we give a lot of liquids that have magnesium citrate to break the stones.
Yes.
So that's part of our medication. I don't think this is easily available on the over the counter. So this has to be prescribed by the doctor itself.
Mm-hmm. So Jackie says I had is it Bosniak cyst removed on the left upper kidney by Dr. George Arun at Health City. Excellent healthcare experience. So other things can happen, obviously, to the kidneys. They can have cysts and they can have cancer. These are types of surgeries that you would do as well.
So I don't do that surgery because yes, urologists do the surgeries.
Okay.
Cyst formation can be a part of your aging of the kidney. So after 40 years of age, anybody can have cyst, but those cysts are very small. So when your cyst is bigger than 3 centimeter, or you have some element of mass inside the cyst, so you might think of it could be a cancer. So it could be just a cancer precursor. So as he said, is a Bosniak 3. That means there is something inside the cyst that warned him it could turn into cancer, and they have done the surgery. It's a good thing that we got it removed.
Very good. Louisa is asking about the desalinization process of water in here in Cayman, wondering if the amount of calcium that could be in the water, if it has an impact on stone formation. So does the type of water that we drink have any impact on whether or not we might have a higher incidence of kidney stones in the community?
See, for water should be the TDS should be less than 400 for a good healthy drinking of water. But yes, calcium in the water will not cause kidney stones, because sometimes we give calcium tablets to the patient because it binds the oxalate that comes in the vegetables or in your diet, so they don't get absorbed into your blood. So calcium as such, heavy calcium will not cause stone formation. The one thing that causes stone formation is one kind of hormone disease in our body is called hyperparathyroidism. Your parathyroid hormones that is on the side of your thyroid gland, they sometimes overproduce this hormone, and they take the calcium from the food into the blood, and they form a stone formation. Only those diseases will cause. And this may increase for vitamin D deficiency. So vitamin D is one that we should be checking of all the patients that have stone formation. If they have low vitamin D, we need to give the vitamin D, and we also have to check those hormones. So those things only if you are taking a lot of calcium and your hormone imbalance there, they will absorb more calcium to the blood and form stones. But otherwise, taking a lot of calcium by itself will not cause stone formation, because there is a inherent blocking system in your body. What you overtake, they will stop absorbing them into your blood.
Okay. So we have a caller on the line. Good morning, caller. Welcome to the program.
Hi, morning, Sandra. Lavona here.
Morning.
I just wanted to give my personal experience when I had the kidney stone. Just to let everybody know, don't just assume that, oh, it's gas pain, because that's initially what I thought. When I first got the pain, I was like, okay, I haven't eaten whatever, and I felt like I wanted to throw up. That was unusual. So anyway, it got so bad that I literally couldn't stand, couldn't do nothing. I was just bent over. A coworker took me to Georgetown Hospital, and they thought I was literally bent over, couldn't move in so much pain. And it was, when I tell you, I had 3 children, and the pain was nothing near that having children. And they told me to have a seat. I was like, my coworker, he was like, what, we mean have a seat? So I just said, please call my husband, let's go to health center. And he came, and we got to health center, and I'm a matter of minutes. Doctors swarmed me in the emergency area, and right off the bat, they said to me, I told them where the pain was, whatever, and they said, did you vomit? Did you throw up? I said, yes, I threw up at work. My husband had to stop in the middle of the road for me to throw up. And they said right off, it sounds like you have kidney stones. Didn't take them 2 minutes for them to say that that's what they thought it was. So I had to wait for a while in the evening for him to do a scan because my stomach had to be, I think, completely like empty or whatever. And they did a scan, and my stone was so big that it was no way for me to pass it. That's how big mine was.
Wow.
So as they found it, they said right away, we have to do emergency surgery because if it had got to traveling further, you would have gotten, been in danger then. So yeah, right away, like I said, what they did in the emergency first of all was to eliminate. They gave me some drugs. I'm not sure what it was, but they were awesome. I went pain free right away. They gave me something to calm the pain, and then I did the surgery. They had to also insert a stent into me, which went from my private area to the whatever that area there that goes to your kidneys. So I had that in for maybe about, I think it was about 2-3 weeks or so. Yeah, and because they break it up like with laser, so I guess if the end to get away and kind of like travel, I think that was supposed to prevent it from traveling. Yeah, but again, it's obvious reasons why health it is like, they really do a good job right off the bat. It was nothing. I didn't have to wait. It wasn't their emergency, and I keep saying this to people, their emergency room or area is really an emergency. They treat you from you get into the door till you leave like you're an emergency. Your attention there is like, I will always speak highly of them because with my personal experience, yeah, I have nothing bad to say about that place, and the doctors and the staff are awesome. So just saying what I said initially is to please don't, if you get certain pain, if it lasts for a prolonged period, do not just assume it's gas, because a lot of us Caymanians do that, especially our older Caymanians. Oh, that gas, just drink this, just drink that. And my coworkers, they were rubbing my back and the pain just wasn't going anywhere. Like, this isn't normal. So when I literally wanted to throw up. And then that's when I said something not right. I need to get, go look after. So that's my personal experience with it.
Okay. Wow. Thank you so much, Levon. I really appreciate that.
But yeah, I wouldn't wish a pain on nobody. I don't care who like me, who don't like me. I don't wish that on my biggest, whoever my enemies out there, I wouldn't wish that on them. That's how bad it was.
Wow.
I was literally on the floor, curl up in my husband's car. I could not sit. It was terrible. He was so frightened. He didn't know what to do. He said that was the most frightening thing he ever seen in his life. I was just telling him to hurry, 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 and he couldn't go no faster. It was really, really bad.
Thank you so much.
Anyway, I'm good now. Yeah, thank you.
Wonderful. So, can the kidney stone, doc, be so big that it's going to? Is there any such thing as death by kidney stone? Because it sounds so incredibly painful.
Yeah, no, it's quite painful, and sometimes what happens is the initial pain goes away, and people used to ignore the kidney stones, and they keep on being there for a long time and damaging the kidney. So if first instance of stone pain, if it is not addressed, the stone is not removed, we keep on following them so that at some point of time you might need to remove it, otherwise it will damage the kidney. So you have to be aware if there is silent stone, it may be a different thing, but stone with a pain, it must be removed or dislodged from that place. That's the most important thing that we have to recognize.
Wonderful. So one final question, and then we're going to let the good doctor go. Stephanie says, did he say Hashimoto disease? Did you mention anything?
No, Hashimoto is something about the thyroid. So I was talking about parathyroid. There are very small 4 glands on the side of thyroid, up and down. So they are very small. Their only work is to balance the calcium and phosphorus in the body. And they go for a toss. They can have their own tumor. They can have their own disease. Sometimes patients with kidney disease could have some problem in that parathyroid hormone. So those are the patients who have disbalance in the calcium, and they are at different categories. Like I'll say less than 1% of patients will have parathyroid gland problem, which leads to kidney stones. So most of the time kidney stones is a lifestyle disease. due to a less water intake, more salt intake, and obesities. All these causes contribute to their kidney stone formation. So kidney stone as such is just a small part of the era of the whole thing of kidney disease. So kidney disease could be due to diabetes, kidney disease could be due to other diseases, intrinsic diseases of the kidney that to be recognized. And most of the times GPs do catch up these problems in the reports, and they can always refer, because in the island it was not previously possible to have a kidney biopsy to see what is happening inside the kidney. Now I'm here, I'm an interventional nephrologist, so I do kidney biopsies, I do catheter insertions, I do AV fistula creations, a lot of surgeries that related to patients with kidney disease. I do that. So for this patient doesn't have to run to US or UK to do these things. They are all available in the island right now. So I'll suggest patients, whenever the GPs recognize any kidney problem, do come and meet us so we can help you out in these situations.
Okay, so Stephanie, hopefully that clarifies it. Hunter's asking about thyroid specialists. So listen, folks, the best thing to do, Health City Cayman Islands keeps bringing in amazing specialists. You can contact them directly in 640-4040. Their email address is info@healthcity.ky, and reach out to them. I mean, they always are bringing people on board. And of course, we bring them here in the program so that you can learn more about the services that they offer and the specialists. So again, Dr. Amit is the only nephrologist.
So there are other nephrologists in the island. I'm not the only, but yes, I'm going to be starting the kidney transplant. That will be the first transplant in Ireland. That first
transplant. Okay. And you said you were doing, and on average, in India, how many transplants would you do? How many would you do like per month?
So per month we have around 20 to 22 transplants. So like we have 3 times a week transplant days, and every day we do 2 transplants. So in a year we have around 250 to 300. I'm not the only doctor there. So in my hospital there were 10 doctors. So my transplant numbers in last 5 years were around 300. So they're all following with me, because transplant doesn't mean only the patient, it's the donor also. I am following up with the donor. They're healthy, they're doing good. So that's what is the success of transplant. It's not about patients, it's about the donor also.
Very good. Wonderful. Thank you so much, Doc. Really appreciate it.
Thank you.
Okay, my dear. Have a good day. All righty. So again, folks, Dr. Amit, go ahead and give him a call. Give Health City a call, 640-4040. And I just want to remind everyone of the upcoming Catwalk for Cancer event. Again, this is to help raise funds for the Cayman Islands Cancer Society. Get your tickets. It's going to be this Thursday, March the 7th at 6:30 p.m. at the Paseo there at Cayman Bay. All proceeds are going to be going to the Cayman Islands Cancer Society. So make sure that you get your tickets early. Today is Tuesday, so you've got pretty much just another day, but don't wait, because there is limited availability, and you can get your tickets at both the Cayman Islands Cancer Society and at Sand Angels. So go out and support this amazing cause. So fantastic. So again, thank you so much to our guests this morning. Every single Tuesday morning, you find Health City here as part of the Medical Rundown Tuesday, sharing with us all of the amazing services that they offer. So I'm sure Hunter was asking that question. He says that's a no. That doesn't mean that that's a no. That means that they probably do. I can actually ask, let me see now. I'm sure they have thyroid specialists. I mean, that seems logical. They've got all sorts of other specialists. So, okay, we'll get a definitive answer for you. But what you got to do, Hunter, is tune in every single Tuesday, because they do all of the rotation of their specialists and their services here on the program. All right. So good morning to everybody. Let's take a quick commercial break. We do have some announcements as it relates to Taste of Cayman, which we're going to make a little bit later on. You might be on your second cup of coffee by now, because we're going to turn up the heat just a little bit, or maybe a lot, here in the studio this morning. Oh, honey child, I got a story to tell y'all. It is a story of slackness to the 9th degree. But let's take a quick commercial break.
This 13th of April at Festival Green, Camana Bay, get ready to experience the culinary capital of the Caribbean. To support local restaurants. To celebrate Cayman heritage. To feel the rhythm and dance the night away with family and friends. Get ready to taste. Get your tickets online now. Visit tasteofcayman.org.
Hey, Cayman! Y'all already know we have the best wings at Popeyes. You made ghost pepper our top sellers, and then you did the same with sweet and spicy. Well, get your taste buds ready, because we are expanding our flavor range. We've added honey barbecue, roasted garlic parmesan, and signature hot. You can choose to sauce our mild wings, or the bravest of you can even sauce on top of our ghost pepper wings. The wing game is over. 5 new flavors with Cayman's favorite chicken, only at Popeyes on Eastern Avenue.
All right, folks, welcome back. Welcome back. So make sure that you get your Taste of Cayman tickets early. I will be there. And can I tell you, the lineup this year so far, and there's still people coming forward. So don't forget, if you're interested in obviously being a vendor at Taste of Cayman, you got to get in there early. So first of all, Black Eyed Peas is going to be here in concert. So this is a big deal this year. So they actually are kicking off the annual Taste of Cayman event with a side of Black Eyed Peas. That is so funny. This is a 6-time Grammy Award-winning band, and this is the real Black Eyed Peas. This isn't a cover band or a make-believe band or whatever. This is the real deal. So they're going to be here, and they're going to be performing with a one-night-only concert on the Friday, April the 12th. We're hoping to score an interview with them here on The Cold Hard Truth, honey chill. That would be totally awesome. Of course, they're known for a string of worldwide hits, including things like I Got a Feeling, Where's the Love, one of my favorites from them, and Don't Stop the Party. And they have collaborated with successful artists such as Fergie, Justin Timberlake, Shakira, and many more. So the concert time, the gates open at 7 o'clock. Again, get your tickets for that event early visit the website tasteofcayman.org. They also have coming up as part of the Taste of Cayman, sort of events. There's going to be a full weekend of entertainment, food, and fun. So this is the annual, in case you don't know what Taste of Cayman is, maybe some of you have never heard of it before. It is the annual premier food and drink festival. Again, they're going to be presenting, full weekend of jam-packed entertainment. DART has come on board as a sponsor for the concert on the Friday night, and that's going to be fantastic. And then, of course, we go straight through for the entertainment and all of the good tasting events through Saturday, April the 13th. So that's the big taste. Returns to Festival Green. You guys know the location, the same one as last year. And this is where our culinary capital of the Caribbean is going to really, really come and be highlighted, because we have this annual tasting of all of these amazing, you've got culinary demos, delicious bites, sips from 25 plus food and drink vendors across the island, mixology and local food contests, performances by local dancers and musicians, fireworks, and then a main stage that's going to be jam-packed with a lot of music performances to dance the night away. So you get your tickets. Listen up now. You're going to have full menu of ticket choices to appeal to any of you as festival goers. If you're ready to experience this, go again to the website, tasteofcayman.org, and get your tickets early, I would say. They actually are bundling tickets this year. So if you want to do the concert on Friday night, and then the Taste of Cayman on Saturday, you can do a bundle deal for both of those events, and you get 10% off. We love a discount. So they also have a la carte menu options where you can pick the ticket for what you want. So again, they're doing things a little bit different. We'll have Jay, I'm sure, come on and explain how different the ticket system is going to work this year. But they're encouraging you to actually pre-purchase like a certain amount of tickets, but then this year you're going to be getting your tickets directly from the vendor as well. So you got 3 options for tickets: general admission, That's $140. It gives you access to the concert grounds where food and drinks are available to purchase. Then you have premium stage view. That's $300. It gets you right in front of the main stage, close up for the Black Eyed Peas. And then you have a VIP option, which is going to get you express, private entry, unlimited access to the VIP hospitality lounge where you can purchase drinks at the VIP bar, priority parking, VIP bathroom. This sounds nice. And an exclusive main stage viewing area. And again, those VIP tickets are $500. So yeah, weekend of fun. All right. So how do you purchase tickets? You can get them online, tasteofcayman.org/tickets. Physical tickets are expected to be on sale at various retail location outlets throughout the island. And then they're going to do a couple pop-up sale booths very soon as well. So keep an eye out for those. We'll let you know once those pop-up booths are up and running. So stay tuned. DMS broadcasting stations are going to have all that information. You can check the websites. We are a media sponsor as well. So you can check, our social media pages. And of course, Taste of Cayman has their own social media page as well. So this is pretty exciting. All right. So I'm going to tell you guys a little bit more about it, a bit more in the program. Now, here's one really, really important thing I don't want you guys to forget, because you got to plan ahead now if you intend to enter any of the competitions. So it's very important to remember that they have the annual 2 competitions that Caymanians love. So they have the Cayman style beef competition, and you also have the heavy cake competition. So, sign up, honey chill. So if you're interested, you think you've got the best Cayman style beef or the best heavy cake, go to tasteofcayman.org/become a competitor. I'm going to put the link here. I want you guys to sign up. I would think this is great. And you can be entered as a contestant where you can prepare your best version of your heavy cake and your Cayman style beef for your chance to be crowned the champion and win prizes. So don't let this opportunity pass you up, honey chill. So I'm going to put the link right here. I'm tempted. I must tell you, I'm really tempted. Not so much the Cayman style beef, but I'm tempted to do the heavy cake competition. I'm still thinking about it. I don't know. Because then if I win, you guys are going to be like, oh my God, we're not sure if Sandy should have won. So I don't know. I'm thinking about it. Okay, I might do it just for fun. All right. So there's a link. Everybody go check it out. Marco, good morning. Hunter says that he saw Black Eyed Peas in Singapore last year at the Grand Prix, and I hope that they're bringing Kuya. Damien says, just for the record, Cayman style beef is not shredded. Well, you don't do the shredding yourself, but it does fall apart on its own. So, Rough C says, what's the Black Eyed Peas without Fergie? I think actually it's a whole band, so I don't know, but yep. They're still going to be performing their same songs. Good morning, Miss Rosita. How are you? So good morning to everyone. Roll call, all in one. Big good morning to everyone. Hope you guys are doing well. So let's talk about a few things that happened yesterday. Instagram, folks, fingers crossed. I don't want to jinx anything, but so far we've been good this morning. So hopefully maybe that problem is resolved. Don't put your goat mouth on it, honey chill. All right, so let's move on. So yesterday I was at court and I came across a situation that really kind of made me pause and think about how slack the DPP's office is. Listen, I don't really, sometimes I feel like, oh my gosh, I don't want y'all to think that I'm picking at anybody, because God knows, I really am rooting for them. You know what I'm saying? I'm there like, okay, they're trying to take criminals off the road. They don't always get it right. I think more often than not, to be quite frank and honest, they might have the right people, but there are requirements, folks, that they follow procedure, that they do things the right way. I can't argue that when they screw up procedurally, that anybody should turn a blind eye, because what ends up happening is you lose faith in the system. Listen, I've been through the system. So I'm like, I think that yes, if there are procedures in place, they need to follow the procedures. You can't just get the person any way, shape, that you want. I was actually talking to a lawyer this morning about this, and I 1,000% agree with her. She's a defense attorney. And when she says, they have to follow procedure, it's important. When they allege charges, that doesn't necessarily mean that the person is guilty. And of course, it's really, really important that the police are not above the process. The DPP's office is not above the process in their quest to achieve justice against any offender. So you have to think about yourself. What if you were the person who was there being accused of something that you may or may not have done? And let me be very, very clear. I do find that the requirement to follow the processes normally works in favor of the defendant. So if they screw up, a lot of times the defendant is still going to walk away, scot-free, and they might not get a second bite at that cherry. So then they have to wait and see if the person's going to end up breaking the law and stuff as they had before. But it is very, 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 very important that the Office of Public Prosecution does their job, and they do it within the legal requirements, and they do things in a particular way, just like the police. It would be easy for us to say, well, the police should go out there knocking people's heads together and just pick up any and everybody off the streets. I hear, listen, when we're frustrated and, crime is going a particular way, I hear y'all sometimes saying these sorts of things. And I do think that it's interesting, because no one would want their loved ones to be subjected to that. And so I know that we say it out of frustration, like, just go pick these guys up and throw them in jail and, deny them bail and this and that. I know we say those things because we are frustrated, and I understand where the frustration comes from. But when it is you or your loved one, everyone is entitled to due process. Yes? But you can have due process, and you can also still have justice. And so it becomes a question of finding, it's a balancing act at the end of the day, but finding that balancing act, making sure that the police have adequate powers to do their jobs, that the prosecution has adequate powers to do their jobs, but they have to stay within the confines of the law. Now, defense attorneys do something completely different. And I think what a lot of people don't recognize is oftentimes defense attorneys, they'll put forward their client's position. They're not fact checking to see if their client has told the truth. A defendant doesn't have to be honest. Somebody posted something yesterday, which I thought was interesting. I think they might have sent this to me. I can't remember if it was a WhatsApp, but they said that, defendants have a right to lie. And I'm like, well, they don't have a right to lie. It's not like somebody's saying, if you're lying, we're going to give you a pass. But the truth of the matter is they lie on a regular basis. Yeah, all the time. They lie to their lawyers, and the lawyers are not necessarily fact checking anything. Let me give you an example of what I mean. When, McKeeva Bush's defense says, he has arthritic knees and a bad disc in his back. Do you think that his lawyer is asking for medical records to prove that that's the case? Like, when was the last time you went to the doctor, and did the doctor issue you this cane and this roller and whatever? No, that's not how it happens, right? So I think we need to understand the process. And lawyers don't ask the questions. They just are sitting there putting forward the position of their client. And so the judges and the magistrates, they kind of know. Sometimes they'll come right out and they say, well, I don't believe your client. I don't believe any of this. Sometimes the defendants put out stories that are so incredibly crazy and without any real degree of merit that the judges go, this story just isn't believable. And a lot of magistrates and judges, they have to make a judgment call about what to believe and what not to believe. A perfect example of this is when we were doing the Miss Cayman trial, right? She claimed she had a brain tumor. She claimed, I mean, she's making up all sorts of stuff. Her version of events that happened that night, the judge said, your version of events just isn't believable. Okay, like none of it makes sense. You're claiming that you were the victim and you were the one who was attacked and this and that. And, you know, I believe we have another eyewitness here, the father who was attacked. And she's like, I believe the father over you, and here's why. And she listed all the reasons why her story just didn't add up. It didn't make any sense. And so that's why she was found guilty, because her story was not believable. And there was no independent verification. There was nothing there to support what she would have said. You know, she showed up at the scene. She was the one throwing the bicycle in multiple vehicles and causing all this havoc. And the way that she claimed that, you know, she was attacked first, it just, in the mind of the magistrate, just didn't make any sense. Like, I don't believe you. And there were things that you did leading up to it. You had an opportunity to leave. You rode your bicycle all the way to this man's house. Why did you do all of this stuff? You know, you didn't have to do that. And then after somebody's found guilty, then there comes the sentencing phase where, again, jurors don't decide. They decide guilt or innocence. They don't decide what the sentence is going to be. The judge or magistrate then does that. So again, with the sentencing phase, you have two things that happens, right? You have a lot happens, but short form version, you have mitigating factors that are put forward, and then you have aggravating factors. So a mitigating factor is something that works in favor of the defendant. An aggravating factor is something that works against. These are very basic definitions, folks. It's something that works against the defendant. So for example, an aggravating factor might be, and there's certain guidelines when it comes to sentencing guidelines that they follow, and the aggravating factors might already be established in those guidelines. So it could be that we're following guidelines that say, if you commit a robbery at night, it's a place of business. There are people at the business at the time of the commission of the offense. You used a weapon, you used a gun, you injured those people with a gun. All of those things would be additional aggravating factors. So there's a whole list of what could be, say, for example, with personal assaults or robbery or whatever, what could be considered an aggravating factor. Mitigating factors, that's the defense's job. So when they get up, a lot of times they'll do written submissions before they do their oral arguments, because the judge wants to see, you know, what the written submissions are, if there's any case law that they might need to consider, et cetera, et cetera. The defense attorney gets up and they want to talk about, they're not going to focus on the aggravating factors. They're going to try to diminish those, like, oh, well, it wasn't really that bad, because their job, if their client is found guilty, is to get them the least amount of time possible. So, oh, he's a father, she's a mother. These are the things that they throw out there, right? Oh, you know, they have no previous convictions. They're a person of good character. So that is something, if you've never been in trouble with the law before, that works in your favor. You're less likely to get a heavier sentence if you're a first-time offender, because they're like, okay, we want you to come back out here, be able to rehabilitate yourself and, you know, move past this mistake or this poor decision or whatever that you've made, and still have a chance at living your best life. So there's a lot of mitigating factors. People might talk about, oh, you know, you have an illness, lots of things. Sometimes the judges are not very sympathetic, because they're like, listen, when you decided to pull off the Tortuga robbery, did you not know that you had children? Right? So now you're trying to argue this is a mitigating factor. The judge is like, but you knew you had children. So why are you getting involved in masterminding a robbery if you knew you had children? You, as a defendant who has now been found guilty, was not paying attention or didn't care enough about your family life to say, yeah, this might not be a good idea for me to go out there and commit a crime, because I'm a mom who's going to mind my kid if I do that. So it doesn't weigh as heavily on them as you might think, because they're like, yeah, whose job was that? That was your job. So I'm going to tell y'all now about a specific case that kind of had me scratching my head yesterday. So I went to court, And I saw, actually in the morning, I saw it when I was kind of going through the list yesterday, that there's a guy being sentenced at 1 o'clock. So this was interesting. And I thought, oh, he's illegal landing. And the offenses were, hold on, let me tell you, is 3 counts or 4 counts? So illegal landing, and then basically supplying ganja possession. So I'm like, oh, okay. From the charges, it's obvious that this is one of those canoe boat trips from Jamaica, right? Comes in with his drugs and trying to unload it on our community. So I said, all right, this is interesting. I'm going to pop in and hear a little bit about this case. What I didn't expect to see or to hear is usual DPP incompetence. So there was a total of 4 offenses, 2 of illegal landing, importation of ganja, and possession of ganja with intent to supply. 4 counts. And so when I looked at the guy's name, right, I'm going to show you guys this because you're going to see why I kind of paused a little bit. When I saw his name, it occurred to me that that looked like a typo and that his name was actually misspelled. Now, I look at these things and they register in my head for different reasons. And I thought, okay, that's weird. Did the court do a typo? Did they get it wrong? What is this all about? Anybody here can point out the typo in the name? Let's give you a gift certificate to Popeyes, which, by the way, I need to go pick those up today. I think they're ready for me to pick them up. But anybody can spot the typo here? I think it's fairly easy. Where's Soka? She's like, oh yeah, I don't eat chicken, but I see the typo. So I look at the name and I go, I think I see a typo. Yes. Deania, you have gotten it, honey child. Isaiah is misspelled. There you go. Yep. And I looked at it and go, who spells their name? Listen, some y'all got weird spelling names, not to say, but I thought to myself, I bet you that is misspelled. So anywho, first thing I do is I Google the man and I find, even with the misspelled name, I see where it comes up that he has a criminal record. So imagine my shock and surprisation when I'm sitting in court, hearing the prosecution who went first talk about, yes, these are the factors that the court needs to look at and making sure he gets as much time in jail as possible. But, we admit that he's a person of previous good character. And I'm just like, he is? Because a 2-second Google search came up with a conviction for this guy in Guyana 10 years ago. Now, people might have the same name, so you can't assume that this is the same dude. So what I did, this is just amateur detective skills 101, I looked at his age and his date of birth to come to the conclusion that this is the same guy. And his MO was exactly the same, except they spelled his name right. So this is back in November 2014. Benjamin Isaiah Carrington and Tamara Nicola Douglas, 2 Jamaican nationals, were nabbed with over 60 pounds of marijuana at the Shetty Jagan International Airport in Guyana in April of 2014. They were sentenced to 5 years imprisonment for the offense by a magistrate there in that jurisdiction. So how are you, as the prosecution, sitting here talking about this guy is a person of previous good character and has no convictions? That's what the defense says. And I don't expect the defense to cross-check anything, okay? I don't expect that. Deania, message me on WhatsApp so that I can get your gift certificate, by the way. So yes, I don't expect the defense, my apologies, to cross-check anything, because like I said, that's their job. They just take everybody at their word. I mean, I've seen some cases where I'm like, that is so fake and false, right? Remember the mother who had stolen money and then she claims that she had stolen the money because her kid was like sick and she needed money for the medication and whatever? That was a bold-faced lie. Everybody in Cayman know that this woman was out there taking trips to Miami, supporting man with the money, living her best life. Yes, she has a sick child, but she was not concerned about her sick child. So again, you know, the judges are going to have to think about, well, how much is this going to weigh on the minds of the court? If she's claiming that she stole this money for X and Y, don't you think the prosecution in these types of cases should be doing a much better job? And this is where they're failing the people of the Cayman Islands. Why aren't they looking into what the money was actually spent on? Somebody steals, right? You can look into what kind of lifestyle they were living, how many trips they were taking, how many times did they take this child to the doctor? Did they have insurance? Did they not have insurance? Because people have a very interesting way of making things up when it is convenient for them to do so. So all of a sudden you're looking at jail time, you become the mother of the century. Not so fast, if it's not true. And in my mind, the prosecution, and this is why I'm going to say this, and this might offend some of y'all over in the DPP's office, but two big problems. Number one, we don't have Caymanians there anymore because they've all left in the last year or so since a new head of the DPP has come in. What was left have now left because things have gotten worse. And number two, we just have people who are not really connected because they're not Caymanians. They're not necessarily connected to the community in any meaningful way. So they live in their own little bubbles. You know what I mean? And if it applies to you, it applies to you. If it doesn't apply to you, well, then it doesn't apply to you, right? So whoever the cat fit, they live in their own little bubble, hanging out with their own little European friends, and they don't know nothing about the Caribbean people. And so it goes, okay? So they don't know anything about that defendant. They don't bother to ask any questions to look into it. It's almost as though they simply do not care. So within 2 twos, I'm literally able to confirm that some 10 years ago, this guy did the exact same thing going into Guyana with over 60 pounds. Now, because in that case, he was traveling with a woman who was a hairdresser, and he was listed as a vendor from Kingston, Jamaica. He had half of the marijuana on him, about 34 pounds, and she had the balance of it on her, right? So she had 27 pounds. So he went down for the 34 pounds of marijuana, and she went down for 27 pounds. Now, here's the irony of the situation. Y'all need to pay attention now. Not only does the dude have a pre-existing criminal record that our people here in Cayman knew nothing about, but for 34 pounds of marijuana in Guyana, he was sentenced to 60 months imprisonment. Y'all do the math. 60 months imprisonment for his 34 pounds, which was 15.5 kilos. Yes? Okay. In the Cayman Islands, he came in. I guess this was a solo trip this time. And that's 5 years, right? By my math, 60 divided by 12 months, that's 5 years. So by my math now, he comes in, and for the Cayman Islands, he's bringing 150 pounds, my boy stepping up, of marijuana. In court, they talked about, right, there's certain things that we needed to look at, including the fact that he seemed to have been a big part of the enterprise of bringing the drugs. He wasn't just a courier. He wasn't just a mule. It's not like somebody walked up to him on the street and said, hey, boy, here's a $500. Can you jump on this boat and take the drugs to Cayman for me? No, honey child. They had messages. They had videos of him. He was growing the product. He was growing the plants. He was cultivating it, packaging it, purchased a GPS so he could make sure he got to Cayman and not Cuba by accident, or Honduras or whatever. He was headed right for shores, programmed East End, Cayman Islands, right into his GPS unit. Yes? And so he did all of that, honey child. And then he proceeded to hold on now. He proceeded to get the boat arranged and all that kind of stuff. They found all the messages. They found the video. His phone apparently rendered a lot of evidence that helped get him convicted, right? So he comes in, does his little bit, gets caught. He was here for 7 days in our jurisdiction. He had even arranged, still salesman, he had even pre-arranged to sell 20 pounds of the marijuana before he came to Cayman. You know what he called it? He called it, what was the term that he used again? Something diesel. Oh Lord. What was the term again? I got to ask somebody who was, oh Lord. Oh God. Hold on. I gotta tell y'all. There's a specific term that he used in his messages. Something diesel. What the heck was it again? Hold on. I'm going to try to. Oh man, I had it in my notes, you know. I still tell you. All right. So anyway, he was well about his business. He thought he was going to be, you know, running this big time criminal enterprise. So anyway, he got caught. But again, hold on. I'm going to find out what he called it. I'm trying to remember the descriptive word. Sour diesel. There you go. How y'all know this? Is that a common term? Sour diesel. Yes, that's exactly what he called it. Oh, yes. Okay. Yes. Is that that's the nickname for it? Sour diesel. So he was talking about his sour diesel in the messages and whatever. Okay. So I'm flabbergasted that the prosecution is saying, oh, you know, he doesn't have any previous convictions. I'm like, he doesn't? Because I see one right here, which means that he spent 5 years in jail, got out. We don't know what he did in Jamaica. You see, they don't cross-reference anything. It occurs to me, you know, a lot of these people in the DPP's office happen to be from Jamaica. And if they were really motivated, they could call their friends in Jamaica and say, hey, do a search on this guy for me. Is he in the system? Because I seriously doubt that this dude was arrested in Guyana, right? Spent 5 years in jail. I don't know how much of that they make them serve. Go back to Jamaica and becomes a model citizen, and then turns around and does the exact same thing coming to Cayman. A leopard not changing those stripes, honey child. He was in the marijuana cultivation program there in Jamaica. So he probably has some kind of record in Jamaica as well. Why are we working with regional partners to find out? Thank you, Ricky, over at Instagram. He's laughing about sour diesel. Why are we not, you know, communicating with our regional partners, sharing information to find out who these people are that we even have on our shores? We're not doing none of this. This is pure slackness, Caymanians. We have got to do a better job. It's called intelligence sharing on a regional level. That's why we be having all kind of people come in here and we don't know who they are. Right now, we have a guy who's arrested for rape of his niece, of a child. How old the poor child was? She's like 12 years old or something. And when we brought him up on the show, all these Jamaican women came forward. Sandy, in Jamaica, he was doing the same thing. How many victims he left behind? I'm like, really? I'm not surprised, actually. Because sexual predators, specifically, a lot of them start young and they never stop until they're caught. So I'm not surprised he's left a wake of victims behind in Jamaica. Now, whether or not those women actually tried to press any charges or anything is a totally different question. But sometimes a person will have a criminal record in another jurisdiction that we need to be aware of. Why aren't we aware of these things? Why isn't the DPP's office? If it took me less than a minute to find this man online and put 2 and 2 together and come up with 4, why is the DPP not doing this? What kind of slackness do we have going on here? So he did say, to his credit, I guess, I'm not really sure, the DPP, yes, they said that this wasn't his case. This was the young lady, I forget what her name is now, the Trini young lady, chaperone, whatever, that was involved in the Makiva case. By the way, not for nothing, but apparently she's already Sarah Poussin. What the hell's her name again? Let me see if I can see. Honey child, she's already leaving the DPP's office. She is leaving and going back home because apparently the DPP is having a really hard time keeping staff these days. We're going to talk about why that might be. We'll have a tittle tattle moment in just a second. So make sure you stay tuned for that and get some more Milo, honey chill. So they're having, where's their staff compliments? They're having a really hard time keeping staff. What a hot mess they're in. Can I tell you? This is no bueno. Diversity and equity. Oh, they have the audacity talking about diversity and equity on their website. Oh, I don't think so. That wouldn't be you, honey chill. Y'all are not diverse enough over there. Try and hush. All right, let me see here now. Who we are. Where is the list of staff members? They no longer have them on the website or what? They can't, because then y'all can notice there's not a single Cayman in there anymore. I'm just saying. Okay. Somebody said sour diesel refers to high grade weed. Oh, okay. He claimed it's high grade. Who knows? Because he was growing it himself. But of course he's gonna say it's high grade, right? Yeah, Sonny Joe. Who we are. It says who we are, but I don't see no pictures anymore. So I somehow don't think that they're providing. Where are they? Oh, they purposely removed them because they don't want us to see those names again. We might have to FOI that information. Anywho, okay. So he said it wasn't his case. It was for whatever her name is, Shopper from Pyong from Trinidad. Okay. Actually, I should have her name, Sarah Sungpong. Oh Lord, hold on now. Let me think of the lawyers' names. We would have reported it in the McKeeva case. So let me see now. If I can find the other guy, what's his name? Miskin Casey. If I can find his name. Okay, so Charles Miskin KC. And then her name is, why don't we have her name in this story? Anyway, she was there for the DPP's office. Anybody knows her name? Send me her name. I can't remember her name. Seems like a nice enough young lady. I'm not saying anything like that. But anywho, she was the one who did the trial. But for some reason, she wasn't there for the sentencing hearing. I don't know if it was a scheduling conflict, because sometimes this happens. So then you send another prosecutor in and they just read. They're not even that familiar with the case. And again, this is pure slackness, right? If for some reason you can't go to court and you're sending your colleague, at the very minimum, should you and your colleague not sit down and have a little conference call? Like, I'm going to Zoom you the night before and let me go through some of the intricate details of this. Don't just read a sheet of paper. I want you to be well familiar. So why didn't Sarah Pang Chang Shuang over here know anything about his previous convictions to put in her, arguments for sentencing? And why didn't the new guy, Mr. Ferguson, who took it over, bless his little heart, but he also has a responsibility, in my opinion, to look it over and to maybe just do a quick little cursory search for this guy. Nobody did it. Nobody gives a damn. This is a problem for us. Okay? So the problem is, if the judge knew that he had a pre-existing conviction, went to jail for 5 years, right? That weighs in the sentencing. That is a factor. And in fact, the prosecution said as much, that the three things that we look at when it comes to sentencing, the sentencing guidelines, you look at the previous convictions, you look at how involved the individual was in the process, and what was the third one? I can't remember what the third one was. Anyway, there's three things. Three principal factors to consider. The quantity of ganja, the defendant's role in the enterprise, and the any previous relevant convictions. Only three things. It's not, some of them have a much more exhaustive list. This is not one of those offenses that has an exhaustive list. So you could not even get to consider the three things. Come on now. I mean, this is just slackness as far as I'm concerned. So the defendant's role, yes, they had a lot of evidence about that. The quantity of ganja, 150 pounds. And then you're starting, he has no previous convictions. Really? Actually, he does. So the court sentenced him yesterday. Understand my point that I'm trying to make. The court sentenced him yesterday, not knowing that of the three things, they were all significant. And in fact, this man does have a previous conviction, and not just any previous conviction, for the exact same type of behavior. Why is that significant? Because if the prosecution had known that, had bothered to take the time to research it and figure that out, they could then make the argument that this man is a professional smuggler. This is what he does for a living. He was doing it 10 years ago when he was in his 20s. Here he is now in his 30s, and he's doing the exact same thing. Except instead of trying to come to the airport, now he coming by boat. And it wouldn't take much of a brain cell to figure out, he's probably done this before and got away with it. He's probably come to Cayman before, unloaded drugs, gone back to Jamaica, and he's cultivating another shipment again. And he's getting bold now. He went from 30-something pounds, almost, in total, they were trying to do 60 pounds between them. So he's now more than double that and coming with 150 pounds of ganja. So this is someone who is escalating the amount. He's getting more risky, right? He is a threat to the entire jurisdiction. Why didn't Magistrate Allard have that information in front of her yesterday? Because her DPP don't know how to use Google? They don't believe in using a frigging computer? What is the explanation here that would be acceptable in your minds? To me, it's just in colloquial terms, it is slackness. Pure and simple slackness. And it comes back to the point that we're looking at the DPP under a magnifying glass these days, yes? About just their general slackness. They were slack in the McKeever case. That allowed him to walk. Some of you are questioning if they purposely did it. I don't think they purposely do much of anything. They're just slack. They don't think is the problem. Now, can they correct this? I don't even think so. He's already sentenced. They're not going to appeal it and try to get him the proper sentence and point out that, oops, sorry, Your Honor, we actually did screw up and get this wrong. What is the point of us bringing people from jurisdictions like Jamaica to work in the DPP's office and other places if they're not even thinking, like, once they get here, they're not even thinking regionally, let me check my regional partners to see if this person is in the system. What is the real benefit of having them here? You might as well have a Caymanan who the DPP's office is going to claim, well, they not got no connections. They don't know nobody, blah, blah. Well, you might as well not know nobody if you're going to work here in this jurisdiction with blinders on and your head stuck in the proverbial sand. What is the benefit? Can somebody help me out here? 936-2626. I would love to hear. So, of course, I'm sitting there in court taking my little notes and my eyes are rolling in my head and I'm just shaking my head like, WTF, I cannot believe this. And so afterwards I say, excuse me, lawyers, I'm not trying to get in y'all business or anything, but can you tell me how you didn't know this man had a record, but I do? And I am not that familiar with the case, and I've just come here today. And already I know in 1 minute that the man has a record. Oh, he does? Really? Well, the defense is like, not my business. I'm just here to get him the lightest sentence possible. Y'all want to hear the funniest part? He got sentenced to 4 years in Cayman for 150 pounds of ganja. In Guyana, 10 years ago, he got 5 years for 30 pounds. Now, it seems to me that our legislation might need a little bit catching up, huh? Even on the quantity alone, how are we so behind on the times? Then she gave him, I think it was 12 months to run concurrently or whatever for the landing, the illegal landing. Now, the other thing of interest is because his name was misspelled on the list, I said, you know, I had to make some inquiries at the court. Why isn't guy's name misspelled? Did you guys make a mistake or whatever? Listen to this explanation. Y'all need to help me now. Apparently, when the police send over the charges, because remember, it's the police that charge on the advice of the DPP's office, that means that they send the paperwork then to the court's office. Issue a warrant for the arrest if the person hasn't already been arrested. They send over the documentation. The police are the ones who misspelled Isaiah. He goes through this entire process, being arrested, being charged. Somebody would have had his travel documents, his passport, all of this, and it was never corrected. So now, as you guys see, let me bring it up again. Pay attention, classe. Look here. His middle name is misspelled. And that is on the permanent record. Why hasn't the police, I don't know what the process is for updating this, but why have they not fixed this? Because you see the problem, right? Although I was easily able to find him even with the misspelled name, if his name is spelled correctly, because now you run the risk of media reporting on this story and spelling it as it appears on the court list, which I'm not. I'm spelling his name correctly. But if I didn't, yeah, this would be the name that'd be popping up and not the proper spelling of Isaiah. So once he does this again, after he gets out of jail, y'all don't even have something basic correct, like the man's right name. Help me out here, folks. Help me out here. Which is it? How is this really going to go? And he actually has a very different spelling of Isaiah as well. So can we ask somebody? I mean, I don't know how they do it and how all of that works, but can we please ask someone in the RCIPS to correct the man's name? Because now he's going to jail under the wrong name. Can you please fix the spelling of his name so that it reflects what his proper documentation has? Mind you, he didn't come in legally, and I get it. So he probably didn't even have a passport or a driver's license on him, to be fair to the authorities. But this only requires, they have to identify who the man is, because he could have given him any kind of name. So how do they know that this is Benjamin Isaiah Carrington? This could be Ho Pak Chang Wang Wing, you know, Chinese Jamaican as far as we know. So there had to be some degree of verification of who this man is so that we know who he is. How was that verification done? And when you verified him and you got the correct spelling of his name, why hasn't the courts ever been updated? Why weren't there charge documents and then all the subsequent legal documents tied to that? The charge sheet and everything else fixed to reflect his correct spelling. Anybody going to fix this? Or we're going to once again just ignore this kind of stuff and be like, yeah, whatever. It's a technicality. What a hot mess. You see, these are the little things that trip people up. RCIPS, can y'all please do better? DPP, can y'all please do better? Let me read some of y'all comments on this whole hot mess of a situation. Damien says fingerprints sorry. My apologies. Fingerprints, question mark. Oh, I think I might need a little throat lozenge. Do I have any more? I need to get some more lemon drops. I don't think I have any. All right. Yes, Damien. I don't know whatever happened to the fingerprinting section. And Denver says you call this slackness and no Caymanians working in that department make a Caymanian break the simplest of a criminal of the law and we go on to jail. I think there's some benefits of having Caymanians working in the legal system. I'm just saying. Sandra, good morning. Says she not only robbed Tortuga, she did not pay rent for 2 months and did not want to leave. Oh, Lord, you were her landlord? Oh, honey, child, I feel sorry for you. I had to call the police. She still owes me $3,000 CI. And she has done this to other people out there, and she was always on NAU. Mhm. But if she was on NAU, doesn't NAU owe you the money? I'm just saying. I don't know why she was on NAU, because she just wanted to spend money in her hair and going out to parties. I had to chuckle during that trial, Sandra, when she said that she has a personal, what's it called? She has a personal tailor. And the judge was like, you have a personal tailor? Yeah, somebody makes my clothes so I can go out. And I'm like, I don't even have a personal tailor. And I'm not an NAU. It's just so weird, the lifestyle that these people be trying to play. I'm just like, what? A personal tailor? What the what? All right, then. Nez says, and that people holding PR or status. Good morning to Irvelin. How are you? Joining us from Panama. Hey, are you there with the chamber group? Isn't there a chamber group that went to Panama? I was thinking about going with them. But honey, child, I got to stay home and work. Got a lot of projects this year that I need to get done. Melissa says, nope, it's the prosecutor's job to prove he guilty. Yep. Magnum Opus, good morning, says Jamaicans are in it for the money, not to protect Cayman, but again, it's Caymanians' fault, to be honest. Let me be very clear. That's not something I would say that is unique to Jamaicans. Most people are here for the money, and it ain't got nothing to do with love of country. They don't love Cayman one way or the other. They are here for what they can get. And as soon as that gravy train dries up, they're going to go about their business. I'm not necessarily knocking it. I lived in another man's country. I didn't move to the United States of America while I was a child, so the decision wasn't really mine to make. But even so, when I was there, it wasn't about love of country. That ain't really my country. I'm like, I always got somewhere to go to. So we have to appreciate how people feel. And so, yes, I'm there. I'm going to respect the laws while I'm there and try to do my best and whatever. But I was there to get a benefit from the United States of America. In my case, it was a better environment and educational benefits. Yes. But do no harm. But that don't mean that you got to love somebody else's country and you're going to be there to build their country necessarily either. You're there to build up yourself. So I do chuckle a lot of times when we have foreign nationals who come here and they want to talk about, they built Cayman. I'm like, no, honey child, you built yourself. And in the process of you building yourself, if you somehow might have assisted the people of Cayman Islands, then the world's smallest violin is playing to celebrate you. You didn't come here with some altruistic thing in your head like, I want to help build the Cayman Islands. No, you know what I say to people like that? Stay your behind home and help build your own country. Because if everybody helped build their own country and we all had wonderful countries, that would be the best case scenario, right? People shouldn't have to run from their own country because things are so bad. Hunter says, why aren't we partnering with Jamaica to stop the boats coming in? Well, Jamaica don't care. First of all, you have to be very realistic, Hunter. I'm sure that Jamaican authorities have no interest in this whatsoever. Criminals leaving their borders is probably a good thing for them. They're like, one less that we got to worry about. One less that we're going to have to put in prison and feed. But I do think that there is something to be said for regional partnerships. And I have to wonder if we couldn't do a better job of trying to work with some of our regional partners. Ms. Joy, good morning. Are you joining us from Texas this morning? Yak, what? Not says Caymanians have to do better. You just said the DPP is full of Jamaicans. Well, I actually said it's full of expats. I don't think I specifically said Jamaicans. So let's be very, very clear. They have expats from all over the place. The head of the DPP happens to be an Englishman. And so in my mind, it falls on his shoulders in terms of the hot mess that is going on over there. Caymanians have left. A good number of Caymanians have left, and others, even some of the Jamaicans that were actually very good have left the DPP's office. So if somebody is good at doing their job, The DPP could use their skill set, but not even to them want to stay. And I'm going to talk about again, we're going to get into a tittle-tattle moment here in a second, why I'm hearing that the latest ones are leaving and some of the behavior of the DPP himself, the head of the DPP, that is very, very questionable at best. Melissa, good morning. Alejandro says, because, yeah, man, I know someone, trust me, they do what they feel like. Denver says, our fingerprinting system sitting on the shelf collecting dust. That was a joke in terms of, the fact that we spent millions of dollars and never even got an operational system in place. Wow. Alejandro says, why aren't we even thinking of these things? People's minds are too pure. Take me away, alien emoji. No need. They use the photocopier for hand printing. What? The photocopier? Magnum Opus says diversity and equity. Another soundbite from the civil service that rings hollow. Not says the only people in our judiciary should be the British by the fact that we are BOT. Caymanians, because of course it's our islands, and anybody else should be vetted so strictly that they must struggle to get in. Well, I just said that the head of the DPP is an Englishman and was an Englishman before. You think that is something that is benefiting Caymanians? I hardly think so. In fact, if you speak to all of them that have since left the DPP's office, and we have a long list, some were there for all 10 years and getting nowhere, they would tell you that their issue had nothing to do with the Jamaicans in the DPP. It was, in fact, the English people, the few that are there, and the Canadians, like Miss Saskatchewan, who since left, Darlene Oku, who was causing their lives to be full of a lack of diversity and bringing in their little friends and had a little friendship circle, yada, yada, yada. Go speak to your Caymanians who work there, and you might have a very interesting set of stories to tell. RMR says Caymanians have to stand and be counted now. The social and economic ills become terminal. We're in desperate need of immigration and judicial reforms. What a hot mess. So Damon says he had triple the amount and got the same time for second offense. Wow. Like I said, the court only knows what's presented before it. And as far as the court knows, he is a first-time offender. Now imagine you're the magistrate and you're thinking, oh, wow. At the age of 37, this guy decides to become a criminal. Oh, he's been living a good life in Jamaica up until then, right? He's okay. A person of previous good character. That's because the DPP never did their job until the man had a conviction. The other thing that I found interesting is the previous story on this, which again, this would have come information from the police when they issue their press statements and whatever. They, I believe, named him because they mentioned that he was arrested. And then another guy, Cedric Bertram, who is 57 years old. Somehow they seem to have actually gotten his age wrong as well. And I don't know where that came from, but the first story of his arrest was last year, September. They had him at 35. In my mind, if he's now 37, there's no way in September that he could have been 35. So there's some sort of disparity with the age as well. So somebody need to figure that out about, where that actually came from. Anyway, when he was sentenced, it was kind of interesting because one of the things that he said, which I thought, is he said that he didn't really understand what was happening in court and that he wanted to be there in court as opposed to being on the video link. The judge was like, speaking to the attorney, explained to her, she told him what his sentence was, and then said, talk to your client. If he wants to appeal the sentencing, he's free to do so. There's no requirement for him to be in court. They were just sentencing him, so he showed up by video link. I don't know why he felt like he had to be there to understand what the magistrate was actually saying. Dane Shalette says, what a value for money from the DPP, just like our politicians. Hot mess. Alejandro says, I don't understand why they not understand yet that ganja obviously coming from Jamaica. Don't they know that? I mean, raccoons can make it here. I'm not surprised. Legalize the ganja and eliminate the troublemakers. First of all, Alejandro, do we really need to have this conversation? Legalizing something like marijuana is not going to stop the illegal trade, not at all, because you're not legalizing the illegal trade. Can we utilize a little bit of common sense? If you legalize marijuana, you're going to have proper dispensaries in this country. You're going to have proper people who are either authorized to grow it or authorized to source it from places that you trust, that you know what's in it. You can't just be like, oh, let's just legalize marijuana and have a free-for-all. That does not work anywhere in the world where they legalize marijuana. There has to be controls in place. Marijuana can be grown and mixed with a lot of other things, including fentanyl and other shit that will kill you. So just saying, oh, we're going to just legalize marijuana is not how it would ever work. And so there will always be an illegal trafficking trade, even if you were to legalize marijuana in some shape or form. And it's not going to solve as many problems as you think. Somebody said, go check out the Seattle story of what happened when they legalized drugs. Y'all need to do your research. I would really welcome a good, intelligent argument on the legalization, but don't come to me with no cockamamie story. You have to do your research first. Go to the jurisdictions where they have legalized it, and then come and sit down and have a discourse with that information available to you. Fentanyl is killing people all over the world. Y'all gonna legalize that next? Are you gonna legalize heroin because everybody's using it? What about cocaine? Let's just all start snorting a line. These people love going after your children, so let's legalize child abuse while we're at it. The argument for legalization isn't that, oh, everybody's doing it. That's not a valid argument to legalize something. Mary, good morning. Says this is beyond incompetence and slackness. Are these people really who we are depending on to bring these criminals to justice? They must accept that they messed up and appeal it so that he can get the sentence required by law. Honey child, they now know the information. The public now knows the information. Let us see if the DPP's office will do anything about it. I have my doubts. Rush C says the same thing. Weed wouldn't be a problem if it was just legalized. If anything, he could say this guy was keeping the peace in the prison. Now look what's happening. They're fighting and making the prisoners harder to deal with. They should sell them a pack of spliff just like they would sell them a regular pack of cigarettes. What a hot mess. Good morning, Strong Wilt. Says, I love your top. You look like Christmas. Oh, thank you. Not the Christmas vibe in March. All right. Johan says, I bet the DPP won't get it wrong with Auntie Sandy if and when they get to deal with her in any matters after today's show. #vengeance. Well, they've been coming at me for so many years now, I've lost count. Vengeance is real, and the dude is sure. You better believe it. Speaking of which, hopefully we're going to have an update. I know you guys have been wondering probably what happened with my last case. We were supposed to have a judgment in January. Here we are in March. I was told by my lawyer this morning that we should hear something back March the 22nd. So we wait. Justice in this country takes forever. Court cases take forever. And you know, when I first started being harassed by the police in the DPP's office, I was always like, I want to go to court right now because I know I'm innocent and I can prove it. I was quick to like, let's get it to court. Let's, get it thrown out, which it was the first 5-6 times. Now I don't even care anymore. I got to be honest with you. I'm like, whatever. They delayed another 6 months. Life goes on. I think most people know the real score between me and them. It's just petty and ridiculous. And I'm like, whatever. You know, there's no motivation for them to, because they're like, oh, well, you're not incarcerated, so whatever. There's no motivation for them to prioritize any of my stuff. They're like, no, we have more important things to worry about. I'm like, okay. And I no longer put my life on hold. I'm just like, whatever. Live says, kaboom yourself for that. Oh, I don't even remember what it was. Rusty says, I think the wording of a personal tailor is being misread. I think she meant to say she has a tailor that she uses. Well, she said personal tailor that makes her clothes for her. I don't care whether it's a personal tailor or a tailor that she uses. How can you be on NAU and actually, you know, be having a tailor any at all? That's my point. I don't care if she used a tailor, if she was paying her own bills. When you're doing all this extra stuff and you're on government assistance, that is where the problem comes in. You can live your most fabulous life. I've got a friend too, my bossy friend, Kevin. He goes to the tailor all the time. He's getting outfits tailor-made and custom fitted and this and that and blah, blah, blah. Good for him. But Kevin pays his own bills. He's not relying on government to feed him and to pay his rent. So he can drive around in the biggest Benz he wants. He can floss and go to New York and trips here and there. That's his business. That's not my concern because we're not paying for none of that. No, but she jumped up on plastic surgery and designer body along with fake designer clothes because, you know, just because you can get material that looks like it's Louis Vuitton does not mean that it's from Louis Vuitton. But you're also on government assistance. You're knocking on NAU's door every day. How is this possible? That's like a particular person last week we were talking about on the show. She gone to Miami with her best friend, her new best friend from the nail salon place there in Miami, but you living off of NAU. How the WTF does that work? I'm just saying, live your best life, but not on the dime of the people of the Cayman Islands. Magnum says another shameful example is at the airport. Cayman's the only country that puts its security at the airport in the hands of foreign nationals. Well, that's your own people doing that, Magnum Opus. Your own Caymanians. We're going to talk about minimum wage here in a second because they want to pay the bare minimum and want to abuse people, not pay pensions and not paying all this other stuff. And so they know Caymanians not going to tolerate that. You think John could be pulling these stunts of not paying his bills with Caymanians at the airport? Y'all would have done go find him and deal with that situation. But it's easier to take advantage of poor Jamaicans, poor Filipinos, poor people from wherever the heck he brings them from, and so on. Oh, dope FPS. What does FPS stand for? It says, what's the solution to all of this? Dope, we just need to clean up the place. You know what I'm saying? Have some accountability, have some standards. So I pointed out at least one case, and trust me, I don't sit there as often as I would love to sit there, right? Because I just don't have the time in the day. So if I can catch things like this, imagine how much of this is going on that we, the people, have no real clue about. Seriously. I don't profess to be an overseer. I'm not the ombudsman of the Cayman Islands. I'm not looking at them with a magnifying glass, but this was so glaring to me yesterday. This is but one example. How many more examples exist? How many more that y'all don't know nothing about, that never gets reported on? I was the only person from media there yesterday for this particular case. If I didn't show up, because heaven forbid, I have a life and something else to do. If I wasn't there, this would have gone completely under radar. This morning, y'all would know nothing about it. And that is a problem because that means that the slackness runs very, very deep in the DPP's office. Good morning, caller.
Yeah, morning, son.
Morning.
I would love to know how you make friends, yo.
I'm not looking for friends. What do I need to make friends for?
I know. I mean, boy, that's a very lonely life, yo.
No, it's not. I've got great friends that I've had for 30 years. And I'm perfectly happy.
If you if you know that I use marijuana for therapeutic reasons, and you ought to respect that, right?
What does that have to do with this conversation?
I mean, look at the fact that you
So if you
downgrading a lot of
use
people that
marijuana for
using
therapeutic
ganja.
reasons, hold on a
What?
second. If you use marijuana for
tell me.
therapeutic reasons, are you gonna go and stand up on the coast of East End for the ganja man to bring it in and give you marijuana? You're not gonna go and get it
If my
prescribed
doctor's
from a
not
proper
provided, of
place?
course. If my doctor's not provided, of course, I would do that if I have to do it. What are you talking about, Sunday? You trust where you get your pills from?
Which pills?
I don't know which pills you
Okay,
taking,
well, I
but
don't
you
take
got a
them.
lot of you got quite a few problems that we pretty much know about, but I'm not getting into details of that. That's none of my business.
What
But you could be
problems? What are
talking
you
about high
talking
blood
about?
pressures and all of these
What
type of
problem,
things, and
Alejandro?
Sandy,
You can't
if
come in
you
here
trust where
talking
you getting your
foolishness.
stuff
What
from,
problems
well,
I
you can't
have that I
trust
need
where I
pills
get
for?
my stuff from.
What problems I
No,
have that I
Sandy,
need pills for?
no, not being biased, right? You know, because really and truly, I know that you have a hate on me. At the same time, hate is a very strong word, right?
I have a hate on what?
On me, like because
Why?
of the fact that I like to advocate on something that you don't like, right? So everything that I would say more than likely would sound stupid to you, right? Correct?
Alejandro.
No. Because look, when I have to talk about the situations that you guys uncomfortable talking about, much less even the premiere, and then you don't even consider the fact that at least there's some sense of interest coming from two sides of the stories. Isn't there some sense of consideration of what is going on in the island already? I mean, Jesus Christ, you guys don't even believe in yourselves.
Oh my God. Wow. Lord Jesus, let's set the record straight this morning, okay? The only pill that I take is my blood pressure pill, and I suspect that's because of some of y'all. All right. I take a low dosage of amlodipine. Yes. Doctor prescribed and doctor monitored. I don't take no other pills, folks. I don't need no other pills. If I lose the 50 pounds, I might not even need that one. If I start to really express myself every day, like how I feel, and start beating some people up, I might not need the blood pressure pill either. But that's the only pill I take. I don't know what other pills Alejandro is talking about. And just because I have a disagreement with someone and we don't share the same opinion does not mean that I hate you. That means I'd have to care. Alejandro, I don't know where you get this from, but I really don't care that much. Okay? You call into the program, you're able to share your opinion. That's fine. Everybody know where you stand on the marijuana issue. Everybody know you've been spliffing for a minute. And you can say you do it for whatever reasons. At the end of the day, I'm not so sure it's helping you as much as you think. But that's your choice. That's your business. I'm not here to hate on you. I have friends, and I have beautiful, lovely, wonderful friends. In fact, I have told you guys on numerous occasions, and let me announce it again just in case, my friendship cards are closed. I do not need any more friends. What do you need friends for, honey child? I've got friends who've lasted for 30 plus years, and they are good and wonderful people. I don't need no more, okay? I'm not here seeking acceptance from people, and I need people to like me or not like me. That don't make no difference to me. It's a talk show. There are days that you might get offended. So what? Suck it up, buttercup. I don't really care. Okay? You'll be fine. How does this become a discussion about me and my friendship circle? You see, that's where y'all start to lose the plot. Stay focused on the issues that are facing this country. The only singular issue, unfortunately, that you can focus on is legalizing marijuana. Why is that? Because you think that's going to solve all of our problems? That's all we have to be concerned about? Damien says, I just searched this. By the way, interesting, Damien. I'm just going to get to that. He said, I just searched this on Google. Marijuana use, especially frequently, daily or nearly daily, and in high dosages can cause disorientation And sometimes unpleasant thoughts or feelings of anxiety and paranoia. Well, we see a lot of paranoid people around here. But someone just sent me, hold on a second. Let me try and find it. Just un momento, clase. Someone sent me this last week. And in fact, Renee needs to do a story on this because this is a new study that's out about marijuana. Hold on. Let me see. And it actually said that marijuana is causing y'all problems. Oh my God. Not that. Honey chill. Let me find it. Where somebody sent me the link. Who sent me the link last week about the marijuana study? Hold on. Let me see if I can find it. Somebody sent it to me. I can't remember who it was now. Marijuana. And it's not, unfortunately for you, Alejandro, it's not a study that you're going to like. So you better call up those scientists and ask them if they have friends. Oh, Lord. The search feature on this phone can be so slow. So slow. Can somebody resend it? Whoever you were, if you're listening. Somebody said, please press the red button. Lovely, he pressed it. Okay, let me see. Somebody. Marijuana. Is this it? No. Somebody sent me. Oh. No. Who sent me the ganja marijuana article last week? Oh God. The bottom line is it's actually not healthy for your heart, I think was the one that this last study. Morning, caller.
Good morning, Miss Sandra. How you doing?
Not bad. How are you?
It's Hunter.
Hello, Hunter.
Yes, ma'am. So Alejandro's a good friend of mine. He also lives in my constituency. So I've talked to him quite a bit.
Your constituency? You're elected already?
I mean, well, no, not yet.
Okay,
But
so you can't say your constituency yet.
I'm sorry.
All
Sorry
right.
about that. We're still working out a few kinks, right?
Well, you got to get elected before you call something a constituency, but go on.
I'm sorry.
Yes.
But yeah, so he lives in my area. And I've talked to him about the marijuana. And I mean, by no means am I advocating for legalization. But I think it's important to look at some of the problems that marijuana is causing in the country, right? We have a large demand for it here. I don't know if you know, but I'm pretty sure you know at least one person, and probably everybody who's listening to this program today knows at least one person that's smoking marijuana.
Okay.
So
and demand for it means what?
It's a major industry, right? And obviously it's a criminal industry. And when you look at the case that you dealt with yesterday, it's a case of a man importing marijuana illegally from Jamaica. And, what comes in that boat tends to be marijuana, cocaine, and guns. Guns are legal in Jamaica. So we have to look at where the guns are coming from, right? They're coming from Jamaica. How are they getting here? Illegally on a boat. Why is the boat coming? Because of the marijuana, right? So you see the problems that the marijuana is causing, right? The importation of illegal guns. And, with all the gun crime happening, it's this big criminal ring, right? Where you have drug dealers out. Again, I've mentioned this before, drug dealers that sell only to children. They're putting it in the hands of our children. They're not asking for ID to make sure they're 18 or 21 before they're selling it to them. They're just selling it to them. It's a business, right? And, that also gets you into the same area as the guns and the cocaine. So that's where I think the whole idea of gateway drug comes from. Because, you're in the same vicinity as the cocaine or the guns. So, I was looking at it, and it's important to protect our children and stop the gun violence from happening here in Cayman. So a lot of people are asking me to advocate for marijuana. So I took the liberty to research it and figure out what we could do here. And it's not going to be along the lines of legalization by any means. I mean, we have the EU regulations, the UK regulations. So legalization is just out of the window.
So what are you advocating for?
Well, I'm not necessarily going to be on my platform, but I would advocate for decriminalization of marijuana. You know, like I said, there's a lot of people here smoking it, so the demand.
Well, that's
there,
already happening,
right?
but decriminalization of marijuana for personal use doesn't mean a guy who's bringing in 150 pounds of marijuana isn't going to go to jail. The outcome for him is going to be exactly the same.
Yeah, but he'll still go to jail. But our government now can regulate the marijuana. We could be importing it from overseas countries like the U.S., Canada, maybe even Jamaica. So the one benefit of that is, for one, it's going to be regulated, so it's less likely to get in the hands of children, right?
How do you figure that to be the case? If decriminalizing or even legalizing marijuana is going to have zero impact on what the criminals do, okay? So the criminals are still going to be bringing it in by the boatload. So my question to you:
they're not going to be bringing it in as much because now we're supplying now. So the demand from the criminals will actually go down. We're taking away their financials. There's going to be a lot less boats coming in. I mean,
how do you come to that conclusion? What evidence are you using to say that decriminalizing it is going to mean that people are not going to be bringing it in as much as they're bringing it in now?
Because if we decriminalize the bud, for example, right, and we are importing the bud, right, it's supply and demand. So if we are now actively supplying the marijuana, that takes away the demand from the criminal aspect. This is a very touchy subject.
No, there's nothing touchy. There's nothing touchy about it. I'm just asking you, you've made a statement, right?
Yes,
and
ma'am.
it sounds like that's supposed to be a fact. Where do you get your opinion for that statement from? Based on what? What jurisdiction? What jurisdiction have you seen where marijuana has been decriminalized, right? Or even legalized, and it has had an impact on the flow of it illegally?
Well, I haven't really found any solid evidence from any other jurisdiction, but just like any business, it's about supply and demand. So if our government...
Well, it's not exactly like any business, because, right, when it's an illegal business, there will always be, it's just like the gambling argument. You can legalize gambling all you want. There will always be people in the illegal gambling business. There will always be people in the illegal. You think the growers in Jamaica who are planning to bring their sour diesel here are going to care that your government has now legalized it? There will still be people who don't want to go through the proper channels. They don't want to get it legally, because they want to give it to a teenager so they can go sexually assault her and mix it with other drugs so they can have their way with her at some abandoned house up in North Side, which was happening last week.
You understand the seriousness and the issues that illegal importation of marijuana are causing in our country, right?
And I'm saying that those issues are not going to get any better just because you legalize it.
I beg to differ, Ms. Sandra, because it comes down to education, right? We're going to educate our children. We're going to educate our population. People realize.
Educate them on what?
On the product they're buying. If they're buying illegal marijuana.
Well, children shouldn't be buying any marijuana, to be clear. Children should not be buying it.
They shouldn't be buying it, and the people that are selling it to them shouldn't be selling it to them. But they don't care. They're criminals, right? So when you look at things like the quality of the marijuana that's coming here, we don't know what's in it. There could be pesticides, there could be poison.
Okay.
Right? So once you do educate the population on marijuana, you can get them to understand that, yes, you should be buying from a dispensary because it's been tested, it's clean, it's pure. No one wants to go to a criminal to purchase marijuana. They would much rather purchase it from a reputable source, right? So again,
not necessarily. If you're part of the criminal element, you don't have a problem purchasing whatever you need from criminals.
Well,
because you're also going to get a gun and some bullets and other stuff that you want criminally as well.
Okay, but like I said, Ms. Sandra, I guarantee, and you should fact check, I guarantee you know at least one person, probably more, in your family that are smoking marijuana today, and they have no choice
but that's
but to
not
get it
that's not
from
the
a
point.
criminal.
That isn't the point.
That is the point. The point is that we have such a big demand here in Cayman that the criminals are making a multi-million-dollar enterprise out of it. Right? And in turn, while they're bringing in the marijuana, which might not be so bad for certain uses, they're also bringing in other drugs and illegal firearms. Right?
And they're going to stop doing all of that because you decide to decriminalize marijuana.
I think they'll stop doing it as much. I'm not saying they'll stop completely, but I definitely believe in supply and demand. I'm a businessman. I know how it works. If there's more supply than demand, what happens? Someone's out of business, right?
No, not the criminals. Again, well, you rely on what evidence?
Well, I mean, I'm just relying on what I've been told, what I've heard, what I've seen.
From what you've been told from who? Alejandro? Or who you been told this by?
Well, Alejandro's one of them. I'll tell you, I'm not going to tell you everybody's name because it is an illegal activity. But I do have to, take into consideration what's going on with our population. I'm down to earth. I understand.
So those are the people that you're getting.
That's where you might be missing out, is that you don't understand the full, scope of things, what's going on today in Cayman. Right? You guys are kind of a little bit older. Things were a little different back then. I kind of understand how things are going on today, right? So the bottom line is that we need to stop these. We need to stop these people from coming into our country because they're bringing the guns, they're bringing the cocaine, they're bringing the heavier drugs. It's an illegal enterprise, right? Supply and demand. If we supplied in Cayman,
let me ask you a question, right? Have you contemplated? Let me ask you a question. Because again, you haven't really done any research, so this is a problem. But
I've done quite a bit of research.
Then you would be able to tell me what the research says, not what Alejandro says. So if you've done proper research of jurisdictions where it has been legalized, I want to see how that has stopped the flow of the illegal substance, of the illegal people. But let me ask you a question: Have you also done any research on once you legalize a drug in a particular jurisdiction?
We're not talking about legalization.
All right. Well, decriminalization.
They're two different things.
They definitely are, but I've noticed that in the discussion you've actually confused the two. But fine. Let's say
I did, but I corrected myself.
Let's say that you decriminalize it. Have you looked at other jurisdictions that have either decriminalized or legalized it and see what happens to the illegal? Because you're saying, oh, it's a supply and demand thing. So if everybody can easily get it, and that's, by the way, not what decriminalization is all about. So that's why you have me confused, because that is not what decriminalization is. So if you decriminalize it and you're saying, oh, this is now an issue of supply and demand, and if people can get it a lot easier, that means that that's legalization, not decriminalization. But again, you say you're not confused.
Well, I mean, for medical purposes,
what happens? You can get it now for you can get it now for medical purposes.
But you can't get the bud. That's why no one's getting the medical card. That's what I understand. People don't want to use the oil.
No, they don't. They don't want to get it for medical purposes because they don't need it for medical purposes. They just want to get high. Let's be very, very clear.
Well,
okay. So you say, okay, this is simple business 101. It's about supply and demand. So you dry up their demand for it. And again, that has nothing to do with decriminalization, but whatever. You dry up their demand for it. What do you think those illegal people are going to be doing? What are they going to bring in instead of marijuana? You think they're going to stop bringing in drugs and guns and all this other stuff?
No, they're going to be bringing in, there's going to be less boats coming for one, because there's less demand for marijuana. Can we agree with that?
Alejandro, no, we cannot agree. I mean, Hunter, we cannot agree with that. Because they will bring in, if your theory is correct, and I'm not accepting that your theory is correct, but what someone who's in the market of bringing in and transporting illegal stuff does is they up the ante with the other drugs. So they will up the ante with the cocaine and the other pills and the heroin and the fentanyl, and they'll start bringing in those things by the boatload. Because you're saying the market for marijuana is going to dry up. So are you then going to turn around and legalize all of those things?
No, I would say that we up the ante on them. I don't believe that they deserve to be prosecuted the way that you explained today. I mean, I think that we need to look at serious legislation and figure out ways that we could be penalizing these people to the maximum penalty, because it's the drugs and it's the hard drugs now, like cocaine, the pills, the fentanyl, and the guns that are ruining this country. If it was up to me, I would blow them out the water, pack them in a container with all the drugs, the guns, everything, and I would send it back to Jamaica with Andrew Holin's name on it, because they're out here destroying our country and allowing
People
it to
ask
happen.
what I do to relax. There's nothing I like to do better than book a.
You see what I'm saying? We have to figure out ways to find solutions. By no means am I thinking marijuana is a great idea. It's not gonna be my platform, because obviously we have to look at children, right? But right now, what's going on in Cayman is you have drug dealers out there doing their thing, selling to kids willy-nilly. The kids are all hooked on it. They're getting some bad quality weed. They're probably getting sick from it with all kind of pesticides and bullshit. We don't have any regulations on it. Drug boats are coming in way more than you could even imagine. I can promise you that. And we're not even stopping them. We're doing nothing to stop them. So my proposal is supply it through decriminalization.
But that's not what decriminalization is. I mean, you keep saying decriminalize it, but you're confused.
Look, right.
So if you're saying supply it through decriminalization, that is legalization, which you started out the conversation saying that wasn't going to happen.
Is it if it's for medical purposes, right? The current law for medical purposes allows like oils and tinctures and stuff, right? People clearly want the bud. If we don't give them the bud, they're going to find the bud from someone else. And the someone else that they're finding the bud from is the criminal. So change the legislation, allow the bud to come in for medical purposes, decriminalize it so people can smoke it at home.
And you know that there are people
and
who will say to you,
and they're not going to be losing their job
because
really they love them. Yeah.
Okay. Yeah. So you're a business owner. I know you're coffee and you do disposal business. So you have no issues
moving and removal.
So you have no issues. Let me ask you a question. So you have no issues with someone. You have no issues with someone who is a regular marijuana smoker working for you. Is that correct?
I do have issues, and it's.
But you just said they're not going to have a problem getting a job. So surely, if you're advocating this, then you're going to be the person hiring them to drive your trucks, aren't you?
I can't have someone driving my truck.
Why not? You just said that people smoking marijuana. No. But you're talking about once we decriminalize it and once we legalize it, then they can be out there and they can get a job and still smoke it. My question is, under those circumstances, are you hiring pot smokers in your business?
If those circumstances change and they seem to be respectable, hardworking individuals that are accountable, I have no reason not to hire them.
So you will hire somebody under the influence to drive your heavy trucks, and you see no problem with that.
Would you hire somebody under the influence to drive a heavy truck drinking alcohol, Ms. Andrews?
Absolutely not. And I wouldn't hire. I wouldn't hire anybody under the influence of anything. But you just said that you don't have any issues with that if they're hardworking. Otherwise,
I don't have any issues hiring somebody who smokes marijuana at home, as it's legal, because it's legal to smoke it at home.
That wasn't the question that I just asked you, though. I asked you if you'd be hiring.
You're trying to say that I'm going to let somebody.
I asked you a very clear question. If you would hire those people, and you said yes. Under those circumstances, you have no issues hiring them.
I would hire them, yes, because they're not breaking the law by smoking weed at home. If it was decriminalized, they would be breaking the law if they were smoking weed at work or out in public, because that
don't make no sense. You don't have to be smoking it at your place of work to still be under the influence.
Just
like I could be drunk, I could get drunk before I come into work. And if you know that I'm under the influence of alcohol, you're going to hire me and let me drive your trucks.
Well, is there any evidence that marijuana causes car accidents? Do you know about that? Because you seem to know the evidence. So can you show me the evidence? Can you prove the evidence that people under the influence of marijuana crash cars, like they crash cars when they drink alcohol? Can you prove that? Or are you just making an assumption? Because that's what it sounds like, Ms. Sandra. You're making an assumption. My point is that if somebody in a decriminalized country smokes weed at home, following the law, a law-abiding citizen, can come and work for me, no problem. The second I see him smoking weed and driving my truck, they lost their job.
Well, according to we'll have to take another call, but according to the CDC, since we want evidence, driving under the influence of any drug, including marijuana, is illegal and dangerous. Marijuana affects areas of the brain that control your movements, balance, coordination, memory, and judgment. There's tons of evidence, Hunter, that will prove to you that driving under the influence of alcohol, marijuana, even some prescription drugs will tell you on the labels, do not drive or operate machinery while taking this drug. So yes, that is a problem. Good morning, caller.
Good morning, Sunday. Boy, that guy, he got his act together in the opposite direction.
What a hot mess.
What is wrong with you with him? He's a businessman. Well, he must be selling dope or ganja, and allow somebody to smoke at his workplace or come high. What kind of productive person can that person be? You know, I mean, this guy does, and he's talking about running for the next election. It never ceases to amaze me. You know, that's got to be the craziest thing I've ever heard.
Wow. Well,
you know,
you're not the only one that's wondering what's going on here.
What do you call a dictionary and drugs?
What do you call
a dictionary and drugs?
A dictionary and drugs?
High definition.
Oh my Lord. I thank you, Mr. Dexter. I'm left speechless a lot on this program. Let's read some other comments.
I got one more. It's not a harsh one.
Yes.
Doctor told me I have 1 year to live, so I killed him, and the judge gave me 25 years.
Oh gosh.
Anyway, Sandy.
Thank you. Miss Bonnie says, Papa Jesus, if you're not busy, come here. Hunter needs a visit. Denver says, today I'm confused. What's going on, people? Lord Jesus. Hello?
Yes, ma'am.
Yes.
Are we still on air?
You're back on air. Is there something else
nice.
you wanted to add to the conversation?
Well, no, yeah, because I got cut off. So, you know.
We have other callers, and you know, I've suggested to you before, if you want to just be on air and have all the time you want, DMS offers this wonderful opportunity for you to do so. It's called Get Your Own Program on Bobo 89.1 FM.
Unfortunately, like every other young Cayman in this country, I have to kill myself working just to survive here. So
you mean like me? Like I have to kill myself working to survive too.
Yeah, exactly.
So,
right? So
I still have a 3-hour show. You can make it happen. Do you know that you can even do a pre-recorded show where you can just sit down and share your opinions for whatever amount of time you want? And you can record that at 2:00 in the morning. When I'm up doing work, you could be up doing work at 2:00 in the morning and record your pre-recorded show.
All right, let's take a breath. Right? I just want to say that we have to look at the problems it's causing, right? We have illegal importation. We have children who are getting it easily, no problem. And they're also being introduced to the criminal lifestyle. That's the only problem I have with marijuana. If people want to smoke it, that's their problem. They want to do whatever, that's their problem. We have to look at the problems it's causing, right? Thank you. Have a wonderful day, Miss Sandra.
Okay.
Appreciate you. Always, right? Thank you.
Comment Strong Wilt says, good morning. Another idiot. Alejandro says, study all you want. Clearly, that's not helping our people. Studying not helping our people at all. So let's abandon studying. Let's abandon facts and reason. Jackie says, I think Alejandro is sensitive to your remarks. You think? Please just be mindful to your audience opinions, and same should be us to you. You don't have to be sensitive to me, Jackie, because I actually don't care. I'm not here to hold people's hands. If you're looking for that, you got to go somewhere else. Okay? JC says your questions sometimes are really disappointing for a per. What is per? Like you and zero common sense. I'm not even sure who you're referring to, JC, so maybe clarify. Magnum Opus says, I'm sorry, Hunter, you're not ready for the realm of representation. Maybe someday, but not now. No, sir. Shamir says, you'd be surprised. Some of the best workers out there do smoke marijuana. Never judge a book by its cover. Denver says, you can't make sense of nonsense. Decriminalization, end of subject. Gareth says, Hunter's extremely green to politics. I wonder if he'll be running for election without educating himself further. These politicians will eat him up. Olive says, man, not call Andrew Holiness name. I'm sure Andrew never ever call your name. You sound so dumb. Lord Jesus. Alejandro says, ask the experts, but you're not listening to the experts, so I don't know what the point of that is. Siobhan says, let's move on. This is a dead horse because they're not going to ever legalize it. We're under England. This is not stateside. Gabby says, legalize for recreational use. Civilians can own up to 2 or 3 plants and can walk up to certain amount of grams without arrest. Just saying, I know nothing about drugs. Rakim says, why such hate and on a living, breathing organism? Michael says, Canada legalized small amounts of coke. Go ask how well that's going. Gabby Gale says, Jesus Christ. We're officially off air now. Let me hit that off air button. MRR says, government must place greater emphasis on border control. Well, that deserves a... Chef Kenny says, what about people who smoke marijuana working right now and driving heavy vehicles on the road right now, and you don't see him smoking marijuana? How do you address that? I can tell you that there are workplaces who have heavy equipment workers who test them on a regular basis, and they will not allow anybody under the influence of anything to drive their heavy equipment. And that includes marijuana, because the liability falls on them when something happens. Yasmin says, real fool, it is drugs mess up your brain. This is a thing. If all you think, Sandy, care about Anna, says Symphony of the Seas. Lord Jesus, please go back to work. This person says, let's move on from this topic. They said, for fuck's sake, we're not on air anymore. Sandy, good morning. My poor Alejandro. Sandy, the cannabis oil is what would work for my skin pain, my speech, my cognitive issues. However, as you said, you can't drive when you take these drugs. Another person says, is this guy for real? Another jackass. Lord help us if these fools get into parliament. Cannabis use and road traffic accidents. They have actually sent a link with tons of research from the British Medical Journal. They say, what? Dexter just came out of his corn patch. Lord have mercy. Here's the link. Y'all want evidence. You want research. You want experts. Thank you to the good physician who has shared this link with us. Oh, hold on. Let me grab the link. Y'all want the link. Y'all claim you want the accurate information. Let's see how many of y'all bothered to go and read it. Let me read it since, oh, shoot. Hold on. Let me try to get in here. Hold on a second now, honey chill. One momento. Somehow, I swear that, all right, one second. I could swear that, I've been logged out of this account. What the heck? Strange. All right, hold on a second. Bloop, 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 bloop. Let's see what the good medical journal says here. All right, so according to the, again, the BMG, acute cannabis consumption, this is a 2012 study, a motor vehicle collision risk, systematic review of observational studies and meta-analysis. Objective, to determine whether the acute consumption of cannabinoids by drivers increases the risk of a motor vehicle collision. Well, that's a very simple objective. Design, systematic review of observational studies with meta-analysis, data sources, They did searches in 19 databases, unrestricted by year or language of publication. We also did manual searches of reference lists, conducted a search for unpublished studies, and reviewed the personal libraries of the research team. Review method included observational epidemiology studies of motor vehicle collisions, and an appropriate group control, selected studies that measured recent cannabis use in drivers by toxicology analysis of whole blood or self-report. We excluded experimental or simulator studies, and they also relied on 2 independent reviewers assess risks of bias in each selected study with consensus using the Newcastle Ottawa scale. Risk estimates were combined using random effects models. Results. So we selected 9 studies in the review and meta-analysis. Conclusion: acute cannabis consumption is associated with an increased risk of motor vehicle crash, especially for fatal collisions. Shall I read that again? Conclusions: acute cannabis consumption is associated with an increased risk of a motor vehicle crash, especially for fatal collisions. This information could be used as the basis for campaigns against drug-impaired driving, developing regional or national policies to control acute drug use while driving, and raising public awareness. Anybody else wants to ask where the study's at? There is the link. Go and read the research for yourselves. This person says, Christ, what rock is Hunter under? Alcohol is legal and still gets in the hands of children underage. What? Listen, we can only take a dose of one or the other, Alejandro or Hunter, not both back to back. Somebody said, I just got kicked off of Facebook. I hope I'm not hacked because I can't get back on nor change my password. Funny enough, the exact same thing just happened to me. And I'm wondering, Facebook might be having an issue. Anybody else just experienced this? I literally just got kicked out and I was trying to get back in. It's not taking my password. And I have a very highly encrypted password. So I think something's going on with Facebook. Let's check and see if there's any Facebook outages. But the same thing just happened to me. So something's going on. Somebody else said me too. Somebody else said heard IG too. They must be having an outage. So everybody's having Facebook issues. Oh, Lord Jesus. Renee, do a story on that, please. People having Facebook issues. Somebody says your face is speaking again. Hot mess. What? Somebody's asking WTF is going on with Flo. I still haven't heard. I messaged Flo this morning. I haven't had any updates, so I don't know. Trying to find out. What's this other message? Hold on. Kaboom on the friendship is closed. Yes, honey chow. Please. You don't think I need friends? Oh, you must be so lonely. In fact, I can't keep up with the friends that I have now. Y'all be wanting to go to lunch so often. Honey chow. Right now I'm still trying to catch up with birthday lunches from August with my friends, my real friends. Yes, we still got to do lunch. By the way, friend, you know who you are. Number one friend and cousin. Thank you for the gift certificate. I still need to try and go and get my massage. Yeah, a lot of people having issues on Facebook. What the hell? And you know what? Our Facebook numbers just dropped to 52 people. So I think all y'all are getting kicked off of Facebook. Whoa. What the fuck? No, there's an issue with Facebook. Let me message Renee. Renee, get on the story. Facebook is having issues. My Lord. Renee, Facebook is having issues. Please do a story ASAP. This is why you got to be able to click on that Facebook link sometime, the YouTube link. This other person says, Sour Diesel, how are we going to supply our own marijuana if it's decriminalized? Decriminalization creates a legal demand for an illegal supply. decriminalization does not allow you to grow and reap marijuana. It only lessens the penalty if you're found with a small amount on you. Tell him to go and have some conversations with his constituents. And they put that in quotations. Someone says he was a dealer and still a user. He's conflating the decriminalization with legalization. Yeah, I was confused. I was like legit confused. I don't know what the heck. That conversation started to confuse me. I made some brownies last night. They were not special brownies, but I'm confused. So someone recently tried. That's happening to everybody. And it's not taking your legitimate password. Let me see here. All right. And I can't get back in. Yeah, everybody's having the same issue. And I don't even know my Facebook password. Oh, shoot. Somebody said this is Tammy Walton's son. Jesus Christ, what a mess. I don't know who his mama is. Somebody's selling expired COVID testing kits for $2. A.L. Thompson's. Why? Can you use expired? What would be the purpose of doing that? Why would you buy an expired kit? Okay, that's just weird. I don't know. That's just weird. All right. So here's the latest headline for those of you who care to base your decisions on research and like real information and not off of what people are saying on a talk show. Is marijuana bad for your health? Let me share that link. We can talk about the details another day now that nobody's on Facebook because they're going to miss out. And there's a new study that just came out talking about marijuana use increases your risk of heart attack, heart failure, and stroke. So keep using it, honey child. Like I said, that's your choice. You can have, listen, I'm not here to direct you and tell you how to live your life. If you want to eat yourself to death, you want to eat all the wrong foods, you don't care about your health, you don't care if you're obese, you don't care if you're about to have a heart attack, that's kind of it is your body and ultimately your life, right? If you don't have people in your life that you want to, I don't know, live for, whatever, you don't care, you got to live for yourself. Those are all of your choices. So I'm not here to tell you, I try to encourage you to take better care of yourself overall. Somebody said, I think it's Rusty's, Sandy doesn't support smoking. Of course I don't. Because smoking anything, even smoked meats, is bad for your health. So I don't encourage, if I actually cared about y'all, because you're like, oh, she don't care. Well, if I didn't care at all, we wouldn't be having any discussions on health and wellness. I'd say, go out there, smoke yourself to death, drink yourself to death, shoot up drugs, commit suicide, do whatever you want. But I'm like, no, let's focus on our mental health. Let's focus on, better eating, exercise on a regular basis. All these things help. If you know smoking something is going to give you a stroke, a heart attack, blah, 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 smoking anything does that because it constricts your vessels, your blood vessels. You can't smoke anything safely. I don't care if it's cigarette. I don't care if it's vaping. And I don't care if it's smoking marijuana, if you're smoking a crack cocaine pipe. None of it is good for you. But ultimately, it becomes your choice in terms of what you want to do. What is this? What am I looking at? I don't know. What am I looking at? Oh, good Lord. Anyway, I got to go. I got errands to run and things to do. Lightning Ice Cream says that mental health is very important. And again, these are the things that you got to ensure that you are doing for yourself. All right, Mr. Randall. I need to send Randall this. Uh-huh. Okay. Mm-hmm. All right, folks. I can't say anything more. Y'all will be all right. Have a good day. Go out there and work hard, folks. If you care about your health, there's certain things that you shouldn't do. If you don't care about your health, then it is what it is. All right? Y'all have a beautiful day now, honey child. See you mañana.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.